Pinalakas ang bagong news online TV ng bagong milenyo. Millennial Online TV, ang katropa mo sa pagbabalita.
Ikaw ba stress? O may dinaramdam? O gulong-gulo na talaga isip mo? Tumutok lamang at panoorin dito sa Millennial Online TV. May tuturo po ko sa inyong isang paraan upang maibsan at mabawasan niyang problemado ninyong pag-iisip. Ito ay ang Tai Chi Learning Series. Sana po tumutok po kayo at abangan niyo po kung Sabado po ng umaga yan. Dito lamang po sa Millennial Online TV. Salamat po!
Hanap mo ba ay Unwind Ventures? Tara nang mamangha sa mga tanawin. Ano man ang iyong travel goals? Dadalhin namin kayo. Sa Unwind Ventures at saya. Dito lang sa Wow Biyahe. Kaya wow, di ba?
Abangan dito lang sa Millennial Online TV.
Barangay, pangunahing unit ng pamahalaan lokal kung saan dito pinag-uusapan ang bawat sigalot ng mga residente ng bawat barangay. Dito rin pinag-uusapan ng mga piling halal na opisyal na barangay ang mga proyekto para sa kanilang barangay. Kumustahin natin ang panunungkulan ni Kapitan dito sa Dano Barangay sa Millennial Online TV worldwide, ang katropa ng bawat barangay.
Ating tinatapos ang ating pagpupulong. Maraming salamat po sa inyong pagdalo at tapos na po ang ating session. Enjoy na po tayo.
Mga pangyayaring naganap sa ating kapaligiran, mga balita sa buong linggo, ihimayin, iisa-isahin, dito sa Balitaktakan, aarangkada, kasama si Brian Enyosa, dito lang sa Millennial Online TV. Pinaigting, pinalakas, ang bagong news online TV ng bagong milenyo. Millennial Online TV, ang katropa mo sa pagbabalita.
Mga katropa, ako ang inyong lingkod, Brian Anyosa. Samahan po ninyo ako sa panibago nating programa dito sa Millennial Online TV, ang Balitaktakan, kung saan pag-uusapan natin ang lahat ng mga balitang bumabandera sa isang buong linggo at mga impormasyong dapat ninyong malaman. Paano kami mapanood? I-type lang sa inyong mga Facebook at YouTube account ang Millennial Online TV. Ano pang hihintay mo, katropa? Like, subscribe, at share na! Mga katropa, ako po si Randel Villados, ang online naranista ng bagong milenyo ng Millennial Online TV, na nag-aanyaya sa inyo na makikanta, makisaya, at tumutok sa lahat ng programa ng Millennial Online TV. I-type lamang sa inyong Facebook at YouTube ang Millennial Online TV. Nood na, mga katropa!
Mga katropa, ako po si GHAZI SARIP, ang inyong tagapaghatid ng balita sa bagong milenyo, na nag-aanyaya sa inyo na tunghayan ang aking mga pag-uulat at tumutok sa lahat ng programa dito sa Millennial Online TV. I-type lamang sa inyong Facebook at YouTube ang Millennial Online TV. Nood na mga katropa!
Mga katropa, ako po inyong lingkod, si Rosel Lopez, ang inyong katropa, ang inyong kabarangay ng bagong milenyo. Abangan po ang aking mga tatalakayin na mga kaganapan dito sa ating bansa. At syempre, abangan nyo rin ang gagawin nating pangungumusta sa panunungkulan ni Kapitan sa ating Dalaw Barangay. At syempre, ay tunghayan nyo po ang lahat ng programa ng Millennial Online TV. I-type lamang po sa inyong mga cellphone sa Facebook at YouTube, Millennial Online TV. Okay mga katropa?
Inaigting, pinalakas ang bagong news online TV ng bagong milenyo. Millennial Online TV, ang katropa mo sa pagbabalita. Talakayin, rebisahin, opinyon, pangangaki, aksyonan, kasama si Rosel Lopez, ang inyong katropa, dito lang sa Millennial Online TV, ang katropa mo sa pagbabalita.
Sa aking pagtanda, unawain mo sana ako at pagpasensyahan. Kapag dala ng kalabuan ng mata, ay nakabasag ako ng pinggan. O nakatapon ng sabaw sa pagkainan, wag mo sana akong kagagalitan. Parang dami ng isang matanda. Naahawa ako sa sarili ko sa tuwing sinisigawan mo ako. Kapag mahina na ang tenga ko at hindi ko maintindihan ang sinasabi mo, huwag mo naman sana akong sabihang bingi. Pakiulit na lang ang sinabi mo, pakisulat mo na lang. Pasensya ka na anak. Matanda na talaga ako. Kapag mahina na ang tuhod ko, pagtyagaan mo sana akong tulungang tumayo. Katulad ng pag-alalay ko sa iyo nung nag-aaral ka pa lamang lumakad. Pagpasensyahan mo na sana ako. Kung ako man ay nagiging makulit at paulit-ulit na parang silang plaka, basta pakinggan mo na lang ako. Huwag mo sana akong pagtatawanan o pagsasawaang pakinggan. Natatandaan mo pa ba anak nung bata ka pa? Kapag gusto mo ng lobo, ay paulit-ulit mong sasabihin yon. Paghapon kang nangungulit hanggang hindi mo nakukuha ang gusto mo. Pinagtyagaan ko ang kakulitan mo. Pagpasensyahan mo na rin sana ang aking amoy. Amoy matanda, amoy lupa. Huwag mo sana akong piliting maligo. Mahina na ang katawan ko. Madaling magkasakit kapag nalamigan. Kaya wag mo sana akong pandirihan. Natatandaan mo nung bata ka pa. Pinagtsatsagaan kitang habulin sa ilalim ng kama kapag ayaw mo maligo. Pagpasensyahan mo na sana kung madalas ako'y masungit. Dala na marahil ito ng katandaan. Pagtanda mo, maiintindihan mo rin ako. Kapag may konti kang panahon, magkwentuhan naman tayo. Kahit sandali lang, hinip na ako sa bahay. Paghapon nag-iisa, walang kausap. Alam ko, busy ka sa trabaho. Ngunit nais kong malaman mo na sabik na sabik ako. Makakwentuhan ka kahit alam kong hindi ka interesado sa mga kwento mo. Natatandaan mo anak nung bata ka pa. Pinagtyagaan kong pakinggan at intindihin ang pautal-utal mong kwento tungkol sa iyong teddy bear. At kapag kapag dumating ang sandali na ako'y magkakasakit at maratay sa banig ng karamdaman, huwag mo sana ako pagsawaang alagaan. Pagpasensyaan mo na kung ako man ay maihiyong matumi sa higaan. Pagtsagaan mo sana akong alagaan sa mga huling sandali ng aking buhay. Total, di naman ako magtatagal. Kapag dumating ang sandali ng aking pagpanaw, bakit mo sana ang aking kamay? Bigyan mo ako ng lakas sa loob na harapin ang kamatayan. At huwag ka mag-alala. Kapag kaharap ko na ang Diyos na lumikha, ibubulong ko sa Kanya na pagpalain ka sana. Dahil naging mapagmahal ka sa iyong ama at ina.
Ang inyong matutunghayan at mapapanood ay hatid po sa inyo ng bumubuo ng Millennial Online TV ngayong nahaharap ang ating bansa sa pandemic na COVID-19. Magandang araw po.
Mabuti ka pa, nasa bahay. Sa natutulog mong anak, ikaw ang nakadantay. Ramdam ng pamilya mong sila'y may karamay. Samantalang kami, isang paa nasa hukay. Ewan ko ba kung bakit ang daming nagre-reklamo? Na tila yung bahay nila, parang isang impyerno. Na kahit anong bawal, ipipilit yung gusto. Naisip ko tuloy, sulit ba ang pagod ko? Sulit bang magsalba ng buhay ng iba? Sulit bang harapin ang kalaban na hindi namin nakikita? Kalaban na maaaring nasa loob ko na at pinipigilan kong hindi sa iyo maipasa. Bago ka magreklamong sawa ka na sa sardinas, na dahil walang nightlife, parang ikaw na yung pinakamalas. Gusto kong malaman mo yung hirap na dinaranas ng mga nakikibaka para ikay mailigtas. Alam mo ba yung pakiramdam ng pinandidirihan? Na walang gustong kumausap sa'yo kasi taga-ospital yan. Na kailangan naming ipagpatuloy yung sinumpaang katungkulan na kung mahahawa kami bukas ay walang kasiguraduhan. Alam mo ba yung pakiramdam na takot ka? Pero sa harap ng pasyente, hindi mo pwedeng ipakita. Na yung sarili mong anak, hindi mo makamusta dahil busy-busy ka. Asikasuhin yung iba. Kung naririnig nyo lang yung kabog ng dibdib ko, sa bawat balitang may doktor na yumao, na tumataas yung bilang ng mga positibo at madadagdagan pa yan dahil sa kakalabas nyo. Ilang doktor pa ba ang sasapit sa kamatayan? Anong paliwanag ba para maintindihan na manatili lang kayo sa inyong mga tahanan ay nagampanan nyo na ang ambag nyo sa bayan? Gusto ko pang masilayan ang bukang liwayway. Gusto ko pang akapiling ang mga mahal ko sa buhay. Lahat ng tapang na meron ako ay nakanda kong ialay. Pero katulad po ninyo, ayoko pang mamatay.
Now,
Talakayin, revisahin, opinyon, Halambakin, aksyonan, kasama si Rosel Lopez, ang inyong katropa, dito lang sa Millennial Online TV, ang katropa mo sa pagbabalita. Ayun, magandang hapon mga kaibigan at ngayon po ay araw po ng Miyerkules at ika-10 na po ng buwan ng Nobyembre taong 2021. At syempre, ngayon po ang inyong Wednesday edition ng programang Talakayin, Rebisahin, Opinyon, Palawakin, Aksyonan, Tropa. Syempre ako pa rin inyong kasama, Rosel Lopez, at kasama ko pa rin sa technical side, si Joshua Sumulat Baltao. At yan mga kaibigan, at kumusta na, no? At meron tayong mga ilang babasahing mga balita muna. Pero bago yan, abay batiin muna natin pala yung ating mga Dabarkas na nakatutok, nanonood ngayon sa ating sa Millennial Online TV. Ayan, nakita ko kagad si Bambo Garcia, si Boss Dem, ng Grupong Puwersa, dyan po sa Tugatog, Malabon. At gayon din si Naidang Aisel Esteban. Palagay ko ito'y taga Kuya po, dyan sa Nueva Ecija. Magandang hapon po sa inyo. At yun, ang oras natin sa Hudyat kasi alas 4:20 po ng hapon, Philippine Standard Time. At siyempre, yung iba nating mga katropa na mga LMT, sina Ma'am Jackie Adahar ng May Kawayan, Bulacan at ng programang Luna Serbal. At gayon din ni Sir Romel Martinez, buhat po sa lungsod ng Maynila. Yan. Ayan, magandang hapon po sa inyo. At siyempre, iba natin mga katropa dyan sa bayan ng Hagunoy, kay Cap Mayor Mila Lakap na kasalukuyan po tumatakbo bilang Mayor ng Hagunoy. Talaga naman busy siguro ngayon. At gayon din kay na Police Senior Master Sergeant Randy Reyes, na siyang Chief ng Police Community Relation ng Hagunoy, PNP. At siyempre yung mga kasama niya dyan, sina Police Corporal Rapi Ryan Ramos at siyempre yung kanilang encoder na si Kiana de la Cruz. At siyempre yung puwersa ng Barangay Bayan-Bayanan sa Malabon sa pangunguna po ni Barangay Chairman Ringo Felix at sina Boss Rapi Flores. Boss Rapi, salamat doon sa packing tape na binigay mo. Alam mo, galing yung kay Boss Rapi. Kaya nagpapasalamat tayo kay Boss Rapi doon sa kanyang binigay na packing tape, no? At yun malaki. Hindi ka tulad nung nabibili dyan, maninipis lang, hindi pa madikit. At ayun, malapit na po ang araw ng Pasko, no? At ano na kaya ang mangyayari sa araw ng Pasko? Sa bagay, ngayon pa lang, nung naging alert level 2 na ang Metro Manila, ay medyo parang nakadama na saya ang ating mga kababayan, lalo na yung mga bata dahil after 2 years, no? Isang taon mahigit, no? Kulang-kulang 2 years. Ngayon lang sila nakalabas at ngayon lang sila nakakita ulit ng mall, lalo na yung mga fast food chain na gusto ng mga bata. Ngayon lang ulit sila nakalabas, kaya masayang-masaya po ang mga bata, no? Ang mga anak natin. Kaya anyway, at maganda naman yan at sana magtuloy-tuloy na nga hanggang pero palagay naman sinabi tuloy-tuloy na dahil wala ng COVID. At ayun, magandang hapon din kay Friendship, kay Rebecca Cruz. Friend, medyo talagang pasensya ka na, no? Hindi pa ako masyadong magaling. Actually, hindi pa ako masyadong makalakad. Yun nga lang, although wala na akong saklahi, hindi ko pa pwedeng puwersahin yung paa ko, no? Masakit pa rin kahit paano. Pasensya na, Friendship. At ganyan din si Kuyang Ricky Del Rosario. Ayan, magandang hapon. Nanonood si Friendship Becky naman ay buhat po sa Barangay Baritan dyan sa Malabon. Medyo maaga kami ni Joshua ngayon nagsimula. Kasi nung nakakaraan, medyo ginagabi kami. Ngayon baka gabihin din kami dahil medyo mahaba. Ilang oras, Joshua, yung ating sa Frontliners? Kita nyo, 3 oras, 4, 5, mga 7, hindi kami matatapos. Okay, sa mga kaibigan, at yan ang ating kuhan, yung mga kababayan natin ngayon, na bakas natin na masaya na talaga sila dahil ika nga, open sesame na. No? Pero wag pa rin tayong pakasiguro, ingat pa rin tayo, social distancing, pagsusuot po ng face mask, kailangan ugaliin na po natin yan, no? Para naman tuluyan na talagang totally wala na ito. Alam nyo, itong COVID na ito, marami pong nasaktan, marami pong namatay, maraming namayapa, maging frontliners, maging marami po. At marami po mga kababayan natin, yung mga mahal sa buhay nila na nakakalungkot na nawala. Ang huling-huli nga po, itong aking Diko Sani, kopya ko, na namayapa nga po dahil sa COVID, no? Kaya nakakalungkot din po. Anyway, sana po maging maingat din po tayo lahat. Kahit sabihin nating nag-alert level 2 na, ingat pa rin po tayo. Okay, sa mga kaibigan, at bago tayo magpatuloy at bago natin itunghay sa inyo yung ating itutunghay na dapat nating pakinggan, panoorin yung ginawang deliberasyon uli sa mababang kapulungan ng Kongreso, yung tungkol po sa mga benepisyo ng mga frontliners, no? Ano na ba? Alam ko dati may umaalma na yung mga benepisyo hindi na ibibigay sa kanila samantala sila naka-front, no, just sa sakit na COVID-19 na marami nang namatay, may mga doktor, nurse, no? Yun. Mamaya yan, pero bago yan mga kaibigan, ay tanggapin muna natin ang pag-uulat ng ating kasamang si GHAZI SARIP. Noon ko ngayong pag-uulat po, hinggil po doon sa nangyaring drug operation ng PDEA yata, kung di ako nagkakamali, no, sa isang probinsya. Okay, GHAZI, pasok.
Millennial Online TV News Update.
Arestado ang malaking drug personality sa Catanduanes na kinilalang si Jose Pantisan Andres Jr. matapos ang isinagawang operasyon ng Philippine Drug Enforcement Agency o PDEA noong 8 ng Nobyembre. Nagsagawa naman ng search warrant sa tahanan ng sospek sa Barangay Kalatagan, Tibang Vira, Catanduanes. Nakumpiska rin ng 340,000 pesos na halaga ng shabu sa sospek matapos ang isinagawang search warrant ng mga kinauukulan. Kaugnay pa nito, ayon sa ulat, isa umano ang nasabing sospek sa mga sumuko noong Oplan Tukhang. Bagamat muling bumalik sa illegal na gawain ang sospek. Samantala, nasa kustodiya na ng Virac Municipal Police Station ng sospek para sa karagdagan pang proseso at dokumentasyon. Ayon kay PNP Police Regional Officer 5 Regional Director Jonel Estomo, nais umano nilang magsilbing halimbawa ang matagumpay na operasyon para sa mapagtatagumpayan pa nilang drug cases sa hinaharap. GHAZI SARIP para sa Millennial Online TV. Ang katropa mo sa pagbabalita.
Millennial Online TV News Update.
Ayun, maraming salamat GHAZI SARIP sa iyong pag-uulat. Sa pag-uulat yan ay nagatid sa atin sa oras na alas 4:26 po ng hapon o 27 ng hapon, Philippine Standard Time. Ayun, at nakatutok na sa atin si Miss Jackie Adahar ng programang Lunas Herbal. At sabi niya, good afternoon po. Abay, maganda ka pa sa hapon, Miss Jackie. At ganyan si Bambo Garcia. Ito, malamang to gantong oras kasi si Demi po ay nasa bahay lang yan. Magmula po bago mananghali hanggang onwards na po yan. At mamayang gabi na po ang alis ni Bambo Garcia, ni Boss Demi. Okay, alas 4:27 na ng hapon mga kaibigan. At bago tayo magpatuloy, bago natin itunghay at panoorin nyo yung mga benepisyo dapat sa ating mga frontliners, ay magpapakilala lang muna muli si Joshua Baltao at muli po kaming magbabalik.
Nais mo bang guminhawa ang iyong pakiramdam? Kung ikaw ay may sipon, ubo, lagnat at iba pang nararamdaman, lalo na ang sakit ng katawan, narito na ang Yasmag Magnesium Therapy Oil. Ang Yasmag Magnesium Therapy Oil ay nakatutulong na ibsan ang iyong nararamdaman sa pamamagitan ng pagpahid sa apektadong parte ng katawan, gaya ng noo, balikat, tuhod at kung anuman ang masakit na parte ng iyong katawan. Panoorin ang mga testimonials ng gumamit ng Yasmag.
Yan po, ginagamit niya. Siya po ay isa sa aking mga testimony.
Ako, si Justino Francisco, ay gumagamit ng yasmag na siyang nakapagpalakad sa akin. Kaya kayo, mga kaibigan ko at kakilala, ay pinapayuhan kong gumamit ng product na ito.
Isa sa ating testimony, ikukwento po niya sa inyo yung kanyang result nung siya ay 1 linggo nang nilalagnat at giniginaw ng hihina.
Hi, ako po si Rina Liliantos, 29 years old, taga Sariaya, Quezon po. Nangyari po sa akin, itong mga nakaraang araw po ay hindi ko po maintindihan yung pakiramdam ko, gawa pong ang sakit po sobra ng likod ko, nilalagnat ako, tapos po ay hindi lang po 1 linggo ang nararamdaman ko. Simula po nung July 30 hanggang itong araw, hanggang nung mga nakaraang araw. Yun lang po, nawala lang po ng dahil sa magnesium.
Paano ginawa mo?
Ang ginawa lang po sa akin ay hinaplas po sa akin likod kung saang parte ng katawan ang masakit. Tapos po ay hinilot lang po ako. At hanggang po pagpawisan ako sa pagkahilot na may magnesium. Ayun lang po, sunod-sunod po ang paglagay kung saan banda ang may masakit. At yun nga po, ilang araw lang sa paggamit yun ng magnesium, ako mismo, sarili ko, ramdam ko ang pagbabago sa aking katawan. Dahil po simula nga po nung July 30 hanggang itong itong mga nakaraang araw lang, hindi ako halos makatayo dahil sa sobrang sakit ng aking likod.
Ako po si Leslie. First time ko po mag-try nitong Yasmag Magnesium Therapy. Ang una ko pong naramdaman ang bango niya ang bango niya lang hapin, nakaka-relax ng katawan, and then yung sakit na iniinda ko sa puso, yung sakit-sakit, wala naman ako sakit sa puso, pero yung mga kirot-kirot nawala niya, instant nawala, na tagal ko nang iniinda. And then hindi siya malagkit ipahid.
Binaigting, binalakas ang bagong news online TV ng bagong milenyo. Millennial Online TV, ang katropa mo sa pagbabalita.
Mga katropa, ako ang inyong lingkod, Brian Anyosa. Samahan po ninyo ako sa panibago nating programa dito sa Millennial Online TV, ang Balitaktakan, kung saan pag-uusapan natin ang lahat ng mga balitang bumabandera sa isang buong linggo at mga impormasyong dapat ninyong malaman. Paano kami mapanood? I-type lang sa inyong mga Facebook at YouTube account ang Millennial Online TV. Ano pang hihintay mo, katropa? Like, subscribe, at share na!
Mga katropa, ako po si Randel Villados, ang online naranista ng bagong milenyo ng Millennial Online TV, na nag-aanyaya sa inyo na makikanta, makisaya, at tumutok sa lahat ng programa ng Millennial Online TV. I-type lamang sa inyong Facebook at YouTube ang Millennial Online TV. Nood na, mga katropa!
Mga katropa, ako po si GHAZI Sarip, ang inyong tagapaghatid ng balita sa bagong milenyo, na nag-aanyaya sa inyo na tunghayan ang aking mga pag-uulat at tumutok sa lahat ng programa dito sa Millennial Online TV. I-type lamang sa inyong Facebook at YouTube ang Millennial Online TV. Nood na, mga katropa!
Mga katropa, ako po inyong lingkod, si Rosel Lopez, ang inyong katropa, ang inyong kabarangay ng bagong milenyo. Abangan po ang aking mga tatalakayin na mga kaganapan dito sa ating bansa. At syempre, abangan nyo rin ang gagawin nating pangungumusta sa panunungkulan ni Kapitan sa ating Dalaw Barangay. At syempre, ay tunghayan nyo po ang lahat ng programa ng Millennial Online TV. I-type lamang po sa inyong mga cellphone sa Facebook at YouTube, Millennial Online TV. Okay, mga katropa?
Pinaigting, pinalakas ang bagong news online TV ng bagong milenyo. Millennial Online TV, ang katropa mo sa pagbabalita.
Ayun, magandang hapon uli mga kaibigan at welcome muli sa programang Tropa. No? Oras natin sa udyat, alas 4:34 po ng hapon, Philippine Standard Time. At ayun ba, nanonood yung aking kumare, si Christina Torres Kay. Sabi, tutok na sa Millennial Online TV. God bless pare. Okay, God bless din. At kay Parin Leo. At yun mga kaibigan, abay, ito na, nag-uumpisa na yung mga pag-withdrawhan. No? Ito yung sinasabi nating switching, hika nga, ng mga politiko. Kung maalala nyo ay dapat tatakbong Vice President si Sara Duterte or Presidente, hindi po natuloy, no? At sabi niya hindi niya raw maiiwan ang mga taga Davao, pero doon siya nag-file ng mayor. Pero ngayon, last minute, ay nag-withdraw na siya sa kanyang pagkakandidato as mayor ng Davao City at ang pumalit ay yung kanyang kapatid. Yan ang sinasabi natin, yung mga switching. At gayon din si General Bato de la Rosa na nag-file ng kanyang candidacy, nag-withdraw na rin. So marami ng mga nag-withdraw, no? Ibig sabihin yan ng mga estilo, mga switching na tinasabi, kaya nga may sinasabing substitution. Pero ang tanong, ano ba yung sinasabi ng COMELEC na yung substitution merong mga guidelines na hindi po pwedeng dapat, etc. whatsoever? Diba? Yan ang sinasabi natin. At ngayon, meron pang isa, yung senador, ito yung mismong si Sap Bongo, ay napaiyak pa habang sinasabi niya na siya ATRAS na pag-withdraw bilang sa pagkakandidato ng Vice Presidente ng bansa. So panoorin natin, Joshua, kung paano sinabi ni Senator Bongo sa kanyang pag-atras. Panoorin po natin.
First time ko pong naluha sa speech. Alam niyo bakit? Mababalitaan niyo po sa mga susunod na oras. Alam niyo, magulo ang politika. Ako, payo ko po sa inyo. Kung wala kayo sa politika, huwag nilang pasukin. Pangit man ikwento dito sa inyo, ako po kandidato bilang pangalawang Pangulo. Pero marami pong mga pangyayari sa mga nakaraang oras na ayaw ko, mahirap nung maintindihan. Sa politika, 38 days na po akong kandidato bilang Vice President. Pero siguro dahil sa pagmamahal ko sa ating mahal na Pangulo, tagal po ako nagtrabaho sa kanya. Kilala ko po sa yung pagmamahal niya po sa tao. Diyan ko po natutunan yung Malasakit Center. Itong kandidatura ko bilang Vice Presidente ay maaaring magbago. Kasi hindi ko maiwasan. May mga changes po sa politika na sabi ko nga, napakadumi. Dito ka na nga gustong magserbisyo sa kapwa mo Pilipino, meron mga pagbabago na wala naman po akong magagawa. Dahil po, may mga posisyon naman na, alam niyo itong problema about the substitution dito sa politika. Maaring may mga babago sa mga tatakbuhang posisyon sa mga darating na araw. Ang problema po dyan, kailangan ko umiwas. Gustuhin ko mang magsilbi sa inyo bilang inyong Vice Presidente dahil sa kagustuhan ng ating mahal na Pangulo. Kailangan ko pong umiwas. Malalaman nyo lang po yan sa darating na araw. Nasaktan na ako din sa sinabi ni Mayor June. Sabi niya sa akin na bihira po silang humanga. Huwag niyo po ako ituring na isang senador. Dahil hanggang ngayon, hindi ko pa alam na senador na ako. Tingin ko pa rin sa sarili ko ngayon. Takbo rito, takbo doon. Bilang nasanay po ako bilang isang staff ni Pangulong Duterte. Di naman po ako tatakbo bilang Vice President dahil na rin po sa kagustuhan ni Pangulong Duterte. Kwento ko na lang po sa inyo. Siya po ang dapat na maging kandidato bilang Vice President. Last minute po, ayaw na, nag-withdraw, sabi niya, kasi alam niya, naguguluhin po sa politika. Sasabihin, bakit ka tumakbong Vice Presidente, unconstitutional na yan. So he decided not to run. Sabi niya, Bong, meron tayong partido, kailangan may isa sa atin na tumakbo. So tumakbo po ako. Ngayon as Vice President, 38 days na po akong kandidato bilang Vice Presidente. Malalaman niyo lang po sa mga susunod na oras kung merong changes po sa mga kakandidato. At kung kailangan kong umiwas, wala po ako magagawa. Pero ito lang pong mapapangako ko sa inyo. Kahit kapitan, kahit na ordinaryong mamamayan po ako, patuloy po akong magsiservisyo sa aking kapwa Pilipino.
Ayun, narinig nyo, naiiyak pa talaga si Senator Bongo sa kanyang pagbibitiw, no, bilang opisyal na standard bearer ng PDP bilang Vice President, no? Pero kita nyo, may mga pagbabago raw. Totoo na may sinabi niya. Talagang marumi talaga ang politika, no? So, yun, baka bukas makalawa yan, baka tatakbo na either Sara Duterte, no? Kaya tama-tama ang magtatandem is Bongbong and Sara. Ewan natin, marami pang mangyayari. Sabi nga ni Senator Bongo, malalaman niyo sa mga susunod na araw kung bakit. Paring Leo, medyo inaayos ko pa at yung binigay mong number ay hindi sumasagot. No? Kinokonta ko, hindi sumasagot. Pero inaayos ko na yung video, pinagsusunod-sunod ko na at one of these days ay ilalabas na natin yun. At kinokonta ko hindi sumasagot baka mamaya natatakot, di ko alam. Basta pipilitin natin na makontak. Okay mga kaibigan, alas 4:41 na po ng hapon, Philippine Standard Time. Tuloy-tuloy pa rin tayo sa ating programang Tropa. O talakayin, rebisahin, opinion palawakin, aksyonan, Tropa. Alam nyo kasi itong aking paring Leo, meron pong yung kanyang dating pinasukang agency ay balahura dahil unang-una hindi ho sila hinulugan ng kanilang mga contribution doon po sa Social Security System o SSS. May napakawawalang yan naman ng mga employer na to, di ba? Wala tayong magagawa, talagang ganun Okay. Okay, sa mga kaibigan, bago natin itong yung sinasabi natin sa inyo, basahin muna natin itong balita, no, na buhat po sa Department of Environment and Natural Resources. At ito pong water quality improvement daw ng Manila Bay ay prioridad ng DNR bago muling buksan ang Dolomite Beach, di ba? At tututukan daw ng Department of Environment and Natural Resources o DENR ang pagsisikap na malinis ang kalidad ng tubig sa Manila Bay bago nitong muling buksan ang Dolomite Beach na matatagpuan sa Rojas Boulevard sa Manila, no? At ayon kay Leones, ay ang Manila Bay Task Force na pinamumunuan ng DNR ay gagawa ng mga plano para sa drainage system ng Manila Baywalk Outfalls sa Padre Paura Remedios at Abad. Anya, ang wastewater na nagmumula sa mga bahay at industriya ay ililihis sa sewage treatment plant, habang ang tubig baha naman ay mapupunta sa malaking HDPE o high density polyethylene pipe na may habang 400 meters mula sa seawall. At yun nga, yun ang gagawin ng DNR. At ayon naman kay DNR NCR Regional Executive Director Jacqueline Cancan, na nitong October 25 ang coliform level sa Dolomite Beach area ay umabot na lamang sa 22,000 mpn per 100 milliliters, no? At binigyan din ito na ang pagsasaayos ng water quality at pagpapanatili sa mahaba nitong fecal coliform ay napakalaking hamon. Sinabi naman ni Leones na ang water quality sa Dolomite Beach area ay kinakailangan tutukan upang makamit ang hinahangad na standard level na 100 mpn, 100 ml, kung saan ay maaari na itong maging swimmable. Pwede nang maligo doon pala kung magkakataon. Samantala, binanggit nito na malaking pagbabago sa coliform level na ngayon ay umabot na lamang sa hundreds hanggang thousands kumpara noon na mayroon itong millions of billions bago ang rehabilitasyon sa Manila Bay. Sa ginanap na press conference, inanunsyo ng DNR na mananatiling sarado sa publiko ang Manila Baywalk Dolomite Beach, habang ang MBTF ay patuloy sa second phase ng proyekto at ipagpapatuloy ang Manila Bay Rehabilitation. Habang sarado, maglalabas ang MBTF ng mga lituntunin para sa mga gustong magpakuha ng larawan sa labas ng beach area upang maiwasan ang pagkakaroon ng overcrowding. Dagdag pa dito, nagsasagawa ng minor repair ang Metropolitan Manila Development Authority sa footbridge sa beach area upang mapanatili ang structural integrity nito at matiyak ang kaligtasan ng publiko. At ang ikalawang bahagi ng Dolomite Project ay sisimulan sa lalong madaling panahon at inaasahang matatapos ngayong taon. Kabilang na dito ang paglalagay ng geoengineering structures tulad ng geotubes na tatakip sa 360 meters ng beach area at ang paglalagay ng Dolomite sand at pebbles upang makumpleto ang 500 meters ng dalampasigan. Ang iba pang plano ay ang pagtatayo ng beach at fishing area malapit sa Manila Yacht Club na magsisilbing paliguan at laruan ng mga bata. Ang pagtatayo ng 2 solar-powered comfort rooms, mandamus office, souvenir hub at lighting at landscaping works sa kahabaan ng Manila Baywalk ay plano ring matapos ngayong taon. Maganda talaga. At idinagdag pa ni Antiporda na ito nga ay doon sa sitwasyon, ang pagiging na itong sitwasyon dahil sa pandemic ay babawasan nila ang bilang sa ganon, kung nababawasan ang bilang ng COVID-19 cases, pwede po nilang buksan na ngayong taon yung Dolomite Beach, no, yung sa Manila Bay. Kaya samantala, patuloy din ang sinasagawang rehabilitasyon sa Baseco, Tondo, maging sa mga probinsya ng Cavite, Pampanga at Laguna na sakop po ng Manila Bay. Yan po, magiging palang kung sakali pala, pwede na humaligo ron, no, Joshua? Pag nato na, ligo tayo ron, ha? At sabi po ni Bambo Garcia, pa-shoutout naman to. Kanina pa kita sinishout, shout ako na shout sa'yo, hindi ka nanonood eh. Hindi ka nakikinig, Bambo Garcia. Sinabi ko na nanonood si Bambo Garcia ng grupong puwersa ng Tugatog Malabon. Hindi mo narinig? Kanina ko pa sinyout ko talaga, Boss Demi. Napapagagalitan ka ni Joshua niyan eh. Sinenyasan ako eh. Binati ka na nga araw, pa-shout-shout ka pa eh. Sinyout ka na nga, katakot-takot na shout na nga. Okay, so yan mga kaibigan, ang sinabi ng Department of Environment and Natural Resources. Abangan niyo yun, ha? Wala nang gastos. Doon na maliligo, doon sa Manila Bay, ha? Pwede nang paliguan ng mga bata, lahat, pwede na. Dating ang marumi yun, dating ang madumi, may naliligo, ngayon pa, na inaayos na, mas masarap maligo. Okay mga kaibigan, alas 4:48 po ng hapon Philippine Standard Time. Aba, sabi ni Baki Puma, grappler, haha, puso mo prende, pare, tropa natin yun si Demi. Tropa natin yun, kasama natin yun sa grupong tropa. Pinatatawa ko na si Demi. Sigurado tumatawa yan si Boss Demi, si Bambo Garcia. Okay mga kaibigan, ngayon kamusta na ba? Mayroon pa tayo, although bumaba na ang bilang, medyo alert level 2, pero yung mga frontliners natin, balita? Yung bang mga benepisyo para sa kanila nung sila yung nakikipaglaban sa COVID-19 ay naibigay na? Medyo parang hindi pa yata, no? So alamin natin yan sa ginawang deliberasyon ng mababang kapulungan ng Kongreso kung ano na update about dito sa mga benefits ng mga frontliners. So, pakinggan po natin.
Kung Kagas, ma'am, I understand, wrote a letter that she cannot attend and we have to find a sponsor, ma'am,
Who's
her behalf.
going to sponsor her bill?
Ma'am,
Please find someone who can sponsor kasi kung merong position ang DOH, who can answer, diba?
Yes, ma'am. Yes, ma'am. Opo. We told her that, yes, ma'am. Opo.
Please, okay. What about the national bills? Do we have na the resource persons and the authors? If not complete, at least few authors. Hi, Kong June. Wala kang sound, Kong June. Wala ka pong sound. Baka pwedeng i-substitute mo ako pag-preside.
Good morning, Madam Chair.
Kong June, thank you for attending again. We'll start in, I think, a few minutes.
Morning, Chair.
Hi, Kong. Kong Kaloy, good morning.
Morning, Kong John. Good morning, Kong Franz.
Good morning, Kong Kaloy.
Kumusta?
Ito, naka-recover na.
Nagka-COVID ka?
Yes, Chair.
Tinamaan.
Confine ako sa heart center.
Oh my gosh.
Talagang naabutan din, doon? Sa...
Mahirap pala.
Pareho tayo. So... Mahirap.
Gusto rin mag-antay ng bakanteng bed.
But you look vibrant. Rep, Gato. Mukhang vibrant ang inyong aura.
Kong Franz, kailangan mukhang vibrant kahit hindi pa masyado. I had severe COVID.
Really?
Yes.
Ang sa akin naman, ganun din, nagantay ako ng kwarto sa ospital, pero talagang walang makita. Kaya mabuti umayos ako after a few days. Nagka-pneumonia ako eh.
Severe pneumonia ako. I had to stay 2 days sa emergency room waiting for vacant bed.
Hirap, no?
Pero I'm glad magaling na tayo.
Okay, I think we can start now. Good morning, everyone. This meeting is now called to order. May I call Ma'am Sylvia to lead us on prayer first. Ma'am Sylvia.
Yes, Your Honors. Good morning. Let's bow down our heads and pray in the name of the Father, the Son, and the Holy Spirit. Dear Lord, our Heavenly Father, thank you for your grace and mercy that sustains us. We are here today because you allowed it and you kept us safe from all these times. And as we go through this meeting, guide us, Lord, continually. May your light shine upon us as you give us your wisdom. For your word says, you will not deny those who ask. Help us to resolve these issues that stalks our healthcare system. Please intervene as only you can. Give us clarity of thought to discern what needs to be done. Also help us to have a gentle spirit and respect towards each
Guide us, Lord, to arrive at what you want us to accomplish today. In Jesus' name we pray. Amen.
Amen.
Amen. We'll now proceed to the calling of the roll. May I hear a motion? Kong Jun Gato.
Madam Chair, I move to dispense with the calling of the roll.
Second.
There's a motion to dispense the calling of the roll, duly seconded. Is there any objection? Hearing none, the motion is approved. I would like to recognize the presence of the following members. Our Deputy Speaker, Representative Evie Escudero, Deputy Speaker Baby Arenas, our Minority Leader, Representative Carlos Zarate, Representative Rodolfo Ordonez, Representative Angelica Natasha Co, Representative Adrian Evcas, Representative Bobby Pacquiao, Representative Euphemia Colyamat, Representative Franz Castro, Representative Seriaco Jungato, our Vice Chair, Representative Dalia Loyola, Representative Sherlyn Banyas Nograles, Representative Princess Rihan Sakaluran, Representative Joy Tambonting, Representative Robert Ace Barbers. For the resource persons, we have from the Department of Health, Mr. Rod Napulan, and CHD Davao RD Annabel Yamang. For healthcare workers benefit bills, we have USEC Leopoldo Vega and OIC ASEC Mylene Beltran. From the PhilHealth, we have the PCEO Attorney Dante Geran, and we have SVP Attorney Angel Miranda Jr. From the DBM, we have Dr. Lambert David. We also have Mr. Vincent Perocho, Mr. Carlo Miguel Centeno, and Mr. Justrex Abijero. From the PHA, we have the President, Dr. Jaime Almora. From the P-HAPI, or Private Hospital Association of the Philippines, we have Dr. Jose Rene de Grano, the President. We've invited representative also from the ULAP, League of Provinces, League of Cities, League of Municipalities. We also have from the PMA, or Philippine Medical Association, the President, Dr. Benito Atienza. We have on board, I think, several organizations like from the PNA, or Philippine Nurses Association, the chairperson, Dr. Rosie De Leon from PAMET, or Philippine Association of Medical Technologists. We have Mr. Ronaldo Puno, the President, Philippine Nurses United. We have Ms. Maristela Abenojar, and Alliance of Health Workers. We have Mr. Robert Mendoza. Again, good morning, everyone, and welcome to another meeting of Committee on Health. Because the health of our people will always be pressing concern, especially since we are not yet off the hook despite the declining numbers or cases of COVID-19 in the country, this committee remains committed to the task of crafting laws that are responsive to the needs and aspirations of our people, which includes our health workers, without whom the health system of our country will in no way be able to function. It is for this reason that the opening part of our agenda for today include those bills that seek to provide for the continuing COVID-19 benefits to public and private health workers and barangay health workers during the period of COVID-19 pandemic, which are significant in our continuing quest to champion the right of the people to health. Incidentally, this year, 2021, has been designated as the International Year of Health and Care Workers in appreciation and gratitude for their unwavering dedication in the fight against COVID-19 pandemic. The World Health Organization has launched a year-long campaign under the theme Protect, Invest Together, which highlights the urgent need to invest in health workers for shared dividends in health, jobs, economic opportunity, and equity. The World Health Organization has in fact called on public to ensure that our health and care workforces are supported, protected, motivated, and equipped to deliver safe healthcare at all times, not only during COVID-19, because they are as much needed to accelerate the attainment of SDGs and COVID-19 recovery. Against this backdrop, this committee will deliberate on the following timely and important measures. House Bill number 10198, entitled An Act Granting Continuing COVID-19 Benefits to Public and Private Health Workers during the period of pandemic and providing funds thereof and for other purposes, authored by Representative Joy Myra Tambunting. House Bill number 10285, entitled An Act Granting Continuing COVID-19 Benefits to Public and Private Health Workers and BHWs during the period of COVID-19 pandemic, appropriating or providing funds therefore and for other purposes, authored by Representative Angelica Natasha Co. And another bill, House Bill 10365, an act granting continuing COVID-19 benefits to public and private healthcare workers during the period of COVID-19 pandemic, providing funds therefore and for other purposes, authored by Representative Luis Raymond L. Ray Villafuerte, and House Bill 9640, an act granting special risk allowance and active hazard pay to all health workers in public and private sector in hospital and other health facilities during a public or state of public health emergency, authored by Representatives Carlos Isagani Zarate, Ferdinand Gaite, Eufemia Colyamat, Franz Castro, Arlene Brosas, and Sarah Jane Elago. The committee hopes to expedite the consideration of these bills in order to provide the much-needed assistance to our health workers and frontliners. Also included in the agenda is two of the local bills, House Bill 10219, authored by yours truly. This is an act establishing a general hospital in Mulanay, Quezon. And another bill, House Bill 10114, authored by Representative Didi Cagas, an act establishing a general hospital in the city of Digos in the province of Davao del Sur, to be known as Davao del Sur General Hospital, and appropriating funds therefore. Last but definitely the least in the agenda is the latest updates on the PhilHealth circulars and commitments on House Resolution 1966 as deliberated upon by the committee in its August 17 and 24, 2021 meetings. If you will recall, this representation has filed a House Resolution number 1966, which was unanimously adopted by this committee, to inquire into the confusion brought about by the issuances of PhilHealth on the availment of COVID-19 related benefit packages. As a result of the hearing, a motion was adopted by the members to strongly urge the PhilHealth to review and possibly suspend its circular 2021-0013 on the guidelines of temporary suspension of payment claims or TSPC. It is also significant to remember that as a compromise and to improve their relations with PhilHealth, the healthcare provider groups represented by Philippine Hospital Association, Private Hospital Association of the Philippines, and Philippine Medical Association have called on PhilHealth to avoid biased and unfair evaluation of reimbursement claims by using qualified and knowledgeable claim evaluators. They also called on PhilHealth to refrain from oppressive and abusive use of quasi-judicial power exercise restraint on unfounded accusation of fraud and unethical practice, remove policies that create too much financial risk to hospitals, install a representative of healthcare providers in the governing board of PhilHealth, increase in case rate, and immediately pay COVID-19 reimbursement claims. All this amid the calls of member hospitals and healthcare professionals who will be affected adversely by the circular to review their engagement with PhilHealth and decide which is best for their situation. Now, several months after the meeting, the national holiday to remember our dearly departed, the issue of hospitals to disengage from PhilHealth over its continued failure to pay reimbursement claims has come to life. Para po tayong minumulto ng issue na ito na hindi maganda. At which is why we hope to exercise this particular issue in today's meeting and hopefully once and for all ma-resolve po natin ito. We'll now proceed first on item number 5, which is the committee deliberation on 2 local bills on establishing new hospitals. And to give way on my sponsorship, I would like to turn over to Pong Jun Gato, our Vice Chair, to temporarily preside the meeting. You have the floor, Pong Jun Gato.
Thank you, Madam Chair. I will now temporarily preside on the deliberation of House Bill 10219. May I now call on our dear chairperson, Congresswoman Angelina Tan, for her sponsorship speech.
Maraming salamat po to our Vice Chair, Kong Jun Gato. Magandang umaga po muli sa inyo. I am submitting the explanatory note of the bill as my sponsorship in as much as it already provides the rationale for this proposal. Allow me, however, to stress that legislative records show that this would be the first time since at least the 13th Congress that a measure is being filed involves the municipality of Mulanay, a coastal town in the province of Quezon, much more that the bill seeks to address the medical needs of Mulanayans through the establishment of a public hospital to be known as Mulanay Medical Center. As part of progressive realization of the universal healthcare law for all Filipinos, I am urging this committee to favorably consider this important health measure. Maraming salamat po, Mr. Chair.
Thank you, Madam Chair. Reaction from our resource speaker from the Department of Health.
Good morning. Good morning, sir. Good morning, Congressman. The Honorable Congresswoman Angelina Tan, sponsor of the bill for the Mulanay Memorial Medical Center. Good morning to all members of this august body. I am Dr. Waida Berinya, Head of the Health Facility Operation Development Unit, representing the Regional Director of DOH Calabarzon, Dr. Eduardo C. Hanairo, for this presentation. House Bill number 10219 has been filed by the Honorable Representative Angelina Helen Tan, which seeks to address the medical needs of the people of the municipality of Mulanay and the rest of the province of Quezon, in line with the vision of the Universal Healthcare Law. In view of the above, the following facts and information may be considered. Number 1, Mulanay Medical Center shall be established as a Level 2 General Hospital in the municipality of Mulanay, 3rd District of Quezon. Mulanay is a coastal municipality which is situated at the Bondok Peninsula, the southern part of the province. It has a land area of 420 square meters, the main sources of income of which are agriculture and fisheries. The municipalities of the 3rd District of Quezon, with its corresponding projected population based for the year 2025, are Agdangan, Benavista, Catanawan, General Luna, Macaleon, Mulanay, Padre Burgos, Pitogo, San Andres, San Francisco, San Narciso, and Onisan with a combined projected population of 490,490. MMC's catchment areas as a level 2 general hospital shall be the province of Quezon likewise, which has a total population of 2,367,215. The third district of Quezon has a total inventory of hospital beds of 63, and its bed to population ratio is 0.10 or 1:7,786 persons. So it has a projected bed need of 613 or an unmet bed need of 550 beds. So the Quezon province has a total inventory of hospital beds of 423, and its bed to population ratio is 1:1,951. The ideal of which is 1:800. As per National Allocation Framework of the Philippine Health Facility Development Plan, Quezon Province is classified as Category 2, which means it has low capacity and low gap classification for health needs. In terms of gaps and priority infrastructure per LGU, Quezon is in the medium priority. The level 2 bed need demand in Quezon Province is 1,349, while the current number of level 2 beds is 905. The level 2 bed gaps in year 2025 will be 444. The third district of Quezon has 1 private infirmary and 4 government hospitals, and the primary mode of transportation from Mulanay to these facilities are public utility vehicles, particularly jeepneys and tricycles. These facilities are a private hospital, which is the Dr. Elinda P. Tolentino Medical Clinic and Hospital, which is a 1 hour and 58 minutes to Onisan, and 1 government level 1 hospital, the San Francisco Municipal Hospital, which is 1 hour and 36 minutes to San Francisco. Bundok Peninsula District Hospital, likewise, a public hospital, is a level 1 hospital, which is 38 minutes to Catanawan, and also the San Narciso Municipal Hospital, another level 1 hospital, 1 hour to San Narciso. Quezon Medical Center, a level 2 LGU hospital, is the primary referral hospital located in Lucena City, with an average travel time from Mulanay of about 3 hours and 30 minutes, that is approximately 142 kilometers away. Currently, Quezon Medical Center is functioning at 191 bed occupancy rate, which is way above the recommended 85. Hence, it is also congested. As per the FHSIS morbidity report, leading causes of morbidity in Quezon are acute upper respiratory infections, followed by lifestyle-related morbidities such as hypertension and cardiovascular diseases. Leading causes of mortality likewise reflect the morbidity issues of lifestyle-related diseases such as acute myocardial
assistance and monitoring to its compliance to the different
o pangangailangan ng ibang sektor, bakit naman yung
to my dear colleagues at lahat po ng ating resource persons, isang mapagpalang umaga po sa ating lahat. On behalf of Representative Mercedes D.D. Cagas, may I submit that the explanatory note of HB 10114, an act establishing a general hospital in the city of Digos, in the province of Davao del Sur, to be known as the Davao del Sur General Hospital, and appropriating funds, therefore, be the sponsorship speech. Thank you, Mr. Chair.
Mr. Chair.
Thank you, Congressman Ordonez. Yes, Congressman Kaloy.
Yes, Mr. Chair. Thank you to Kong Ompong. Actually, I was
Opo.
earlier to Chairman Ompong for the sponsorship speech. Actually, I was also requested earlier by the Honorable Congresswoman Didi Cagas because she is now indisposed to sponsor the bill. And with the additional and to adopt her explanatory note as the sponsorship speech, and with the additional manifestation, Mr. Chair, that if there are documentary requirements later on that the Department of Health may require, the Office of the Honorable Didi Cagas will comply with the same as soon as possible. That will be all, Mr. Chair. Thank you.
Thank you, Kong Kaloy. May we now hear from the Department of Health?
Thank you, Mr. Chair. So, good morning po again. So, let me read, Mr. Chair, the position paper of the Health Facility Development Bureau of the Department of Health, which lodged the novel intent of the House Bill number 10114, entitled An Act Establishing a General Hospital in the City of Digos in the Province of Davao del Sur, known as the Davao del Sur General Hospital, and appropriating funds therefore, as introduced by Honorable Mercedes C. Cagas of the representative from the Davao del Sur. In the province of Davao del Sur, there are 1 component city, 1 independent city, and 9 municipalities. It has a estimated bed to population ratio of 1 bed is to 620 population based on its 2022 projected population. The data from the licensing of the Department of Health provides that there are 35 licensed hospitals in the province of Davao del Sur, 33 of which are privately owned, 1 hospital run by the local government unit, and 1 hospital under the direct supervision and control of the Department of Health. The bill seeks to establish a general hospital in the city of Digos, province of Davao del Sur. However, Mr. Chair, I would like to note that there is an existing hospital owned by the said local government unit and is also situated in the same city, in the Digos City. Davao del Sur Provincial Hospital, located in the city of Digos, province of Davao del Sur, is a level 2 hospital with a bed capacity of 100 beds. Based on its 2-year annual hospital statistical report from 2019 to 2020, the average occupancy rate of the said hospital is below the 80%, which is 65.58%. The hospital was underutilized when referring to 80 to 85% standard indicator for the efficiency utilization of resources of the hospital vis-a-vis the occupancy rate for the past 2 years. With these above premises, Mr. Chair, we recommend to strengthen first or upgrade the current service capabilities of the Davao del Sur Provincial Hospital instead of establishing a new hospital, considering the proximity of the proposed and existing hospital and the bed occupancy rate of the Davao del Sur Provincial Hospital. Likewise, we would like also to take opportunity to maybe to strengthen and improve also the existing infirmaries in the province instead of a new hospital. The DOH shall continue to support the above stated local government units through the provision of technical assistance and monitoring its compliance to standards. Capital outlay requirements, subsidy may be provided in accordance with the Philippine Health Facility Development Plan National Allocation Framework, wherein the province of Davao del Sur is identified as Category 1, which is defined as low capacity with the high gaps. And 100% of its capital outlay requirements may be supported by the national government. Further, the Bureau also recommends that the funding for the operations, maintenance, as well as other personal services of the said hospital, once upgraded, be sustained and approved through a resolution from the province of Davao del Sur. So respectfully submitted, Mr. Chair, and we will submit the signed copy once available. Thank you, Mr. Chair. Good morning, all the members of this committee.
Thank you, Sir Rod. May we hear a comment from the Regional Director, Dr. Annabel Yumang? RD Yumang, is she around?
Yes, sir. Good morning po. Yeah. Good
Thank
morning,
you.
sir.
Good
Yeah.
morning.
Thank you so much, sir. So we commend, sir, with the the CHD recognizes also the commendable efforts of the provincial government of Davao del Sur, as well as in prioritizing the healthcare services for its constituents. No, so as mentioned earlier by Sir Rod, no, uh, we have also the same position, sir, but we highly recommend that instead of establishing a new hospital in Digo City, the provincial government should aim to increase its bed capacity, no, of the Davao del Sur Provincial Hospital, which is the current provincial or government hospital in the province. And this will be eventually upgrade this, no, hospital into a level 3 hospital in order to cater the specialized health needs of the province. So this means that we also recommend, sir, that the human resource complement of this increase in beds in Davao del Sur Provincial Hospital be ascertained with the managing local government unit in order to sustain the continuous delivery of quality healthcare services to the constituents of Davao del Sur. So that's all, Mr. Chair, for our comments for this House bill. Thank you so much, sir.
Thank you very much, RD Yumang. Before I proceed, may I recognize the presence of Congressman Robert Ace Barbers, Congresswoman Mickey Biolago, Congresswoman Stella Kimbo, Congressman John Ray Chanco, Congresswoman Lucille Nava, Congresswoman and Vice Chair Ruth Mariano Hernandez, Congresswoman Sara Ilago, and Congressman Ferdinand Gaite. Thank you. Any other reaction from the members? Comments? Any motion for approval?
Mr. Chair.
Yes, Madam Chair.
Yeah, I move for the approval of House Bill 10114, subject to style and amendment and compliance to the requirements set forth by the DOH. So move, Mr. Chair.
Second the motion, Mr. Chair.
Any objection? Hearing none, House Bill number 10114 is now approved, subject to the compliance mentioned by the Department of Health. Thank you. We now move to Agenda 6. May I now turn over the chair to our chair, Chair Helen.
Thank you, Kong Jun. I will now proceed to the deliberation of House bills on providing benefits to public and private healthcare workers during the period of COVID-19 pandemic. First on the item is House Bill 9640, entitled An Act Granting Special Risk Allowance and Active Hazard Pay to All health workers in public and private sector in hospital and other health facilities during a state of public health emergency. Authored by Representative Kaloy Zarate, Representative Gaite, Colyamat, Castro, Rosas, and Elago. May I recognize Representative Caloy, Bong Caloy?
Yes, Madam Chair. Thank you, Madam Chair. Good morning to our colleagues as well as our resource persons. Madam Chair, we filed this House Bill number 9640 on June 23, 2021, in the midst of the raging controversy at the time, when a lot of our healthcare workers do not or did not yet receive the promised UDA for them. No? So may I read our explanatory note for House Bill number 9640, Madam Chair. Amid the raging COVID-19 pandemic and the country's public health crisis, thousands of health workers also got infected with the disease. According to the DOH, as of May 25 this year, 18,539 health workers already got infected with COVID-19. 95 of them died as a result. For numerous times, the health workers aired their grievances over limited and substandard personal protective equipment or PPEs, and the lack of manpower, facilities, medicines, and medical supplies. With the militaristic yet failed pandemic response of the administration, the health workers asked for timeout last August 2020 to slow down the spread of COVID-19 and provide for a breathing space in the fight against the pandemic. Yet, despite all these hazards, Madam Chair and my colleagues, threats of getting infected, lack of personal PPEs, the low wages and benefits, and the inhumane working conditions, health workers relentlessly provide health services to our people. It is very regrettable thus that the current special risk allowance and active hazard duty pay received by our health workers are insufficient and very limited. Pursuant to Administrative Order number 35 and 36 signed by President Duterte, public and private health workers are only entitled to SRAs not exceeding 5,000 pesos, while the frontline human resources for health are entitled to active hazard duty pay not exceeding 3,000 pesos. These amounts are far cry from the health workers' demand of 15,000 special risk allowance and 5,000 active duty hazard duty pay for all health workers. Moreover, based on the DOH Memorandum Circular number 21-0221, only public health workers catering to COVID-19 patients or those who are providing COVID-19 healthcare response during the state of national emergency, medical and allied professionals, and administrative and support personnel are entitled to hazard pay, subsistence, and laundry allowance. The memorandum explicitly excluded healthcare workers hired without the so-called employer-employee relationship, including those who are considered as contractual workers employed through job orders, contract of service, and similar arrangements, and those health workers who are not directly catering the COVID-19 patients and not performing COVID-19 related health services. They are not given these benefits, and despite being at risk of getting infected of the viral disease while giving healthcare services to our people. Thus, Madam Chair, our colleagues, in recognition of the crucial roles and contributions of our health workers amid this still raging public health emergency, this bill seeks to grant SRA and active hazard duty pay to all health workers in the public and private sectors and other health facilities, regardless of employment status, including those who are considered JOs, COS, and other similar arrangement. So We pray for the immediate passage, consideration and passage of this bill, as well as the other pending bills before this committee. Thank you, Madam Chair, and good morning.
Thank you, Kong Kaloy. May I recognize for his sponsorship speech, Kong Ferdinand Gaite.
Thank you, Madam Chair. Can I be heard? Madam Chair, can I be heard?
Yes po.
Opo.
Clear
I
po.
yield to our Bayan Muna Representative Kaloy Sratep as yung kanyang sponsorship speech ay bahagi na rin ng aming sponsorship speech for our bill, House Bill 9640. Salamat po, Madam Chair. At sana rin po makonsider na ito sa pinakamaagang panahon dahil nga sa pressing issue we have been asking why so many of our healthcare workers are opting to work abroad. And this is one of the reasons. Marami ang hindi nakikita nilang commensurate yung tinatanggap nilang sahod at benepisyo doon sa sacrifice na hinaharap nila. At yung iba, bunga na rin ang pangangailangan ng kanilang pamilya at nila ay pinipili pa magtrabaho abroad. If we provide enough benefits, we hope to incentivize them to stay. So yun lang po, Madam Chair, sana po immediately maipasa ito.
Thank you, Kong Gaite. Kong Kolyamat, do you wish to sponsor?
Yes, Madam Chair, ano po, yung sponsorships, yung explanatory note na binasa ni Kong Kaloy Sarapi, bahagi na rin ako doon sa kanyang sponsorship. Tapos ang sa akin lang din ay ninanais na ng representasyong ito. Sana maagarang maisabatas ang panukalang ito dahil nakikita natin na napaka-importante ng papel ng ating mga health workers dito sa ating bansa dahil nakikita natin na sa hirap na dinadaanan nila bilang isang frontliners ay marami pa rin ang nagdidesisyon na magtrabaho sa abroad dahil hindi sapat yung kanilang matatanggap na mga benepisyo dito sa ating bansa. Kaya sana maisabatas ang panukalang ito para sa ating mga health worker. Maraming salamat, Madam Chair.
Kong Franz Castro.
Same with this representation, Madam Chair, we yield to the explanatory note read by our Deputy Minority Leader, Kaloy Saraten. Madam Chair, thank you.
Thank you so much. Do we have Kong Arlene Brosas and Congresswoman Sara Jane Ilago? We'll now proceed on House Bill number 10198, authored by Representative Joy Tambunting on same subject matter. Representative Joy Tambunting, you have the floor.
Good morning, Madam Chair, and good morning to all our colleagues. The Philippine Constitution under Article 2, Section 15 expresses its policy that the state shall protect and promote the right to health of the people and instill health consciousness among them. A presidential proclamation number 922 declaring a state of public health emergency throughout the Philippines was issued last 8 March 2020 and still remains in force up to now, as it is not yet withdrawn nor lifted by the President. Currently, after a year, the COVID-19 outbreak remains to threaten our national security and public health, making our country chiefly dependent on our health workers who serve as our protectors from the said virus. The country's health workers, doctors, and other frontliners in the health sector tirelessly serve and cure those infected with the virus, although most of them do not receive the benefits due to them. It is hard to ignore raging news informing that overworked nurses and doctors stage protests and threats of mass resignation if the government do not make them feel important through provision of allowances and benefits. We must acknowledge that our nation cannot afford to have closed hospitals and understaffed health facilities, especially now that the virus is mutating with precarious variants. The bill seeks to appreciate their significant role by emphasizing their continuing benefits as stated under Republic Act number 11494 or the Bayanihan to Recover as One Act, Bayanihan 2, even though said law already lapsed last 30 June 2021. This law expressed those benefits of the health workers will be granted as long as the declaration of the national emergency is not yet withdrawn by the President. Granting the urgent need of this legislation, we urge its immediate approval and enactment. On behalf of the people of Parañaque City's 2nd District and the common good of the Filipino people, the approval of the said measure is earnestly sought. Maraming salamat po sa inyong lahat.
Thank you so much, Congresswoman Joy. Next is House Bill number 10285 on same subject matter, authored by Representative Angelica Natasha Ko.
Thank you, Madam Chair. I will not elaborate anymore on what our public and private healthcare workers, including our barangay health workers, rightfully deserve in this time of pandemic, and extending their risk allowances and active hazard pay should immediately be given to them. So may I just ask the committee to put into record that my explanatory note be my sponsorship speech. Thank you very much, Madam Chair.
Thank you, Kong Angel. House Bill number 10331, authored by Representative Alfred Vargas. Do we have Representative Vargas? Ma'am Sylvia? If none, we'll now proceed to House Bill number 10365, authored by Representative El Rey Villafuerte Jr. Okay, we'll now hear from the resource persons. Can we hear from the Department of Health? Yusek Vega.
Good morning, ma'am. Good morning, Chairperson Congresswoman Helen Tan, members of Congress, distinguished members of this committee. Allow me to read on the general comments on the 5 proposed bills as discussed. On the benefits stipulated in Section 4, we maintain our proposal to adopt a COVID-19 singular allowance for all public and private healthcare workers that will replace the COVID-19 special risk allowance, active duty hazard pay, meals allowance and transportation, and annual life insurance coverage previously stipulated in Republic Act number 11494 or Bayanihan to Recover as One Act. In this proposal, all public and private healthcare workers will be stratified into 3 COVID-19 risk exposure categories with the corresponding allowance as follows. Risk classification low. It's defined as it performs administrative duties in non-public areas of healthcare facilities, away from other staff members or away from patients that may be known as clean areas. And the COVID singular allowance on the monthly rate is 3,000. For the risk classification medium, it provides care to the general public who are not known or suspected COVID-19, and the COVID-19 singular allowance for the monthly rate of 6,000. For the high risk classification, it's defined as the healthcare worker enters a COVID-19 patient's room, provides care for COVID-19 patients involving or not involving aerosol generating procedures, and collects or handles specimens from known or suspected COVID-19 patients. And the COVID-19 singular allowance for the monthly rate of 9,000. The risk exposure categorization recognizes the occupational hazard faced by all healthcare workers in our healthcare facilities in the context of COVID-19 response, while also giving an incentive for those who work in close or direct contact of COVID-19 cases. The proposed COVID-19 singular allowance has three main advantages. First, it is easier to implement since all benefits are lumped into one. Second, it allows for all healthcare workers to receive the benefit relative to the COVID-19 risk exposure in the workplace. Third, it harmonizes the rate of benefits to be received by both public and private healthcare workers, since AHDP is an exclusive benefit for public healthcare workers. They receive higher allowance than private healthcare workers. With singular allowance, both public and private healthcare workers receive the same singular benefit. Second, on appropriations stipulated in Section 6, we reiterate that proper funding for the proposed benefit should be ensured and allocated annually. We recommend the inclusion of healthcare workers' benefits inclusion as a separate budget line item in the annual General Appropriations Act. In addition, we raise the following point of clarification and suggestion for House Bill number 10285, authored by Representative Angelica Natasio-Co. We would like to clarify, as defined in Republic Act number 7883, barangay health workers are persons who voluntarily render primary healthcare services in the community after having been accredited to function as such by the local health board in accordance with guidelines promulgated by the DOH. We suggest revising the provision as follows: barangay health workers or BHWs assigned in rural health units, isolation or quarantine facilities, or vaccination sites are also covered by this act. Thank you, Your Honor, for providing us this forum for our comments on coming from the department.
Thank you, Yusek Vega. May I call on from the Department of Budget and Management, any representative from the DBM?
Good morning, Madam Chair. This is Paul Peracho from the DBM offices.
Okay, proceed, Sir Paul.
Let me read our draft position paper. We are yet to submit our position paper on the matter, but we have prepared some recommendation which is similar to what we have submitted to the Senate version of the bills. So here are our suggestions. Specifically for House Bill numbers 10198, 10285, and 10331, we would like the bill to specify the rate of COVID-19 SRA and the AHDP to be granted to each health workers per month. And second suggestion, so the bill to provide a complementary provision to define the health workers, non-clinical staff, outsourced personnel, and laboratories, so that such definition shall expand the coverage of the benefits. And third, to include the parameters for the entitlement to the benefits, particularly the COVID-19 AHDP, it is similar to those that is adopted to the Administrative Order number 35 Series 2020, and the parameters that is specified for the COVID-19 SRA that is adopted in the Administrative Order number 36 Series 2020 as amended by AO number 42 Series 2021. Fourth, to include the provision identifying the agencies responsible for the issuance of the implementing rules and regulations, such as the roles of the DBM and the DOH on the grant of SRA, HDP, and the grant of meals, accommodation, transportation, and the life insurance. May we also manifest that we have initial talks about the proposal of the DOH for a single COVID-19.
Black, led by lalong-lalo na yung House Bill 9640, talagang ipinakita yung
extending during this unusual and trying period of the COVID-19 pandemic. Madam Chair, we will be submitting
Zoom.
Maraming salamat, sir. Mr. Mendoza, sino pa po ang gustong magpahayag ng kanilang posisyon or suporta? Anyone from professional organization? Kung wala po, from the League of Provinces of the Philippines, may I call on Ma'am Angelica Sanchez.
Morning, Madam Chair. Good morning, members of the Committee on Health. So I just like to read excerpts of our position paper on the said House bills. The League of Provinces of the Philippines expresses its full support to the noble intention of the bills that seek to provide for allowances and benefits for health workers assigned in hospitals, healthcare facilities, laboratories, medical or quarantine facilities of vaccination sites, and those administering medical assistance, as well as those non-medical personnel similarly situated. The bill seeks to institutionalize for the duration of the pandemic the benefits to health workers that they have been entitled to under Republic Act number 11494 or the Bayanihan to Recover as One Act, Bayanihan 2, until the latter elapsed on June 30, 2021. The League sees the need for an unequivocal policy statement on the continued grant of the COVID-19 Special Risk Allowance and Active Hazard Duty Pay, provision of life insurance, accommodation, transportation, and meals, and provision of compensation to those who have contracted the disease in the performance of their duties as healthcare workers and for those who died from it for the duration of the declaration of the state of national public health emergency by the President. Healthcare professionals and other health workers and other persons working in hospitals, healthcare facilities, laboratories, medical or quarantine facilities of vaccination sites, and those administering medical assistance should rightfully be compensated with additional allowances and benefits sought to be granted in recognition of their heroic efforts to address the healthcare needs of the Filipinos, especially those who have fallen ill from contracting the virus. In consideration of the above-mentioned points, the League of Provinces of the Philippines hereby reiterates its full support for the immediate passage of these legislative measures post-haste to ensure that our health workers and other covered individuals in both the public and private sector are afforded not only just compensation for the service, but additional allowances and benefits for the services that they are extending during this unusual and trying period of the COVID-19 pandemic. Madam Chair, we will be submitting our official position paper after this meeting. Thank you po.
Maraming salamat po, Ma'am Angelica. Kung wala na pong gustong magbigay ng kanilang position, I would like to clarify po from any of the author yung intention ng proposal. Will this be on top of the benefits of previously received? Kasi nagbigay po tayo ng SRA pero selected lang po yung nabigyan. Yun lang because doon sa definition na nakalagay po doon ay those who directly provided care, no, doon sa COVID-19 patient. Or a retroactive application na kung saan nga po yung mga hindi nakatanggap ng SRA and active hazard pay nung from last year up to yung last na ibinigay ngayong June yata yung last, no?
Yes.
Sila lang ba to? So, kay Kong Kaloy, clarify ko lang po yung intention doon sa version po ninyo. This is on top of the benefits previously received.
Yes, Madam Chair, that would be the ideal situation, no, on top of what they already received. But this will actually replace yung dati nang binigay natin, no, na merong quote-unquote discriminatory ang system niya, no, dahil hindi lahat nabibigyan, no? So if this will be enacted into law, ito na yung mag-apply for all public and private sectors, no? And dito rin sa proposal natin, Madam Chair, lahat na, no, kasama na nga yung may mga status na job orders or contract of service and other similar arrangements, no, na nandiyan naman sa ating health system.
Okay, sige. And retroactive po ito, no? So
that's the idea, Madam Chair, but of course, no, we also have to consider the position of the other authors. Thank you, Madam Chair.
May I ask Congresswoman Joy Tambunting, kasi nakalagay po doon sa version niya in Section 4, provided that the SRA and active hazard duty pay shall be in addition to existing benefits received by healthcare workers under existing laws. Kong Joy?
Yes, Madam Chair.
So, ito po ay on top of what our few healthcare workers received yung previous year and up to, I think, first quarter of this year. So,
yes, so ang gusto nila ay karagdagan po.
Karagdagan. Yeah, tanong ko po yung intention doon sa Section 4, Letter A, kina-clarify ko lang po kung may retroactive effect po yung intention ng inyo pong panukala.
Oh, yes, definitely.
Okay. So that the committee secretariat will be guided po when we draft the consolidated version of these bills. And then, alam ko naging problema nung implementation natin under bayanihan is because of that qualifier nga na dapat directly nag-care, no? So nagkaroon ng confusion. So ngayon, inilagay natin both medical and non-medical personnel working in all healthcare facilities. Am I right, no? Kong Kaloy?
Yes, Madam Chair. Yes, Madam Chair.
Congresswoman Joy, ganun din ang intention po ng inyo.
Yes. Definitely, Madam Chair. Definitely po.
Okay. With regards to the proposal ng Section 4 of the version ng 9640 is proposing not prorated na 15,000 SRA and 5,000 active hazard duty pay. Doon po naman sa version ni Congresswoman Joy, silent po, walang nakalagay. Are you willing to adopt the version of House Bill 9640, Kong Joy?
Yes po. Kung anong pinakamaganda po.
Okay.
Chairwoman. Yes
okay,
po.
Thank you so much po. Recommendation ko lang based on experience po, no, to the authors for consideration lang po. Nakalagay po dito yung benefits, additional benefits natin for in case of death, in case of sickness for severe and critical. In reality, ang 100,000 po is very low, no? Marami pong doctors natin, no? Even doctors, nakaranas po sila ng financial hardship doon sa pagbabayad na in-incur po ng hospitalization nila, yung mga nakaranas po ng critical and severe, amounting to more than 1 million. No? Ganun po ang binabayaran nila. So yung 100,000 po ba ay enough? Kung akong tatanungin, nagpahirap po talaga sa kanila yung binayaran nila. Even in mild and moderate cases, because nga po, depende sa approach of treatment of attending physician, gumagamit na sila nung mga non-PNF drugs natin, wherein they have to buy this out of pocket, no? So doon sa 15,000 sa gamot pa lang po ay hindi na. Kasi yung moderate cases ay binibigyan na nila, no? So nag-incur din sila ng hundreds to ang moderate cases to 500,000. So mabigat pa rin po sa ating mga affected individuals even if we give 115,000. Ako ang proposal ko po is to have a comprehensive healthcare benefits, no? So kung magkano in-incur talaga nila at sa treatment, no, at nakasurvive sila, kung kayang i-cover ng PhilHealth, i-cover po ng PhilHealth. Wala dapat out of pocket sila kasi talagang nakakaawa po sila, no? And then, hindi lang siya sa monetary benefits kasi na-experience ko po, ang daming lumalapit sa akin na mga nurses, nursing attendants, janitorial, na totoo pala talaga yung depression ng mga nakaranas po ng COVID. So yung iba, nag-indefinite leave kasi nagte-therapy sila for psychiatric assistance or psychological assistance. So baka pwedeng lagyan natin dito ng other healthcare benefits, no? Yun yung proposal ko, Kong Kaloy and Kong Joy, na hindi lang tayo limited doon sa monetary na natatanggap nila. So halimbawa po, meron po akong kilala na isang nurse na COVID po moderate. Sa sobrang sigurong naranasan niya na fear, ay nag-depression ngayon. So the mother is parang contemplating i-resign na lang niya yung anak niya. So the family now is parang nahihirapan kasi breadwinner yung anak, nurse, na magbayad ngayon sa ating psychiatrist and psychologist, no? And the medicines na ibinibigay po doon sa bata. Ilan na po itong lumapit sa akin na humihingi ng tulong. And I'm sure napakarami nito all over the Philippines. So that's one example of another healthcare benefits na dapat meron ng ating Department of Health and PhilHealth. So, Kong Kaloy, what's your thought on my recommendation po?
Yes, Madam Chair, we welcome the good recommendation of the Chair, no? Coming from the sector itself, no? Sa medical sector, at alam niyo po ang talagang nangyayari, no? Sa ating mga kasamahang healthcare workers, and I also know a lot of friends na directly nag-serve sa mga facilities, and I can also attest na dumaranas pa rin yung iba hanggang ngayon ng matinding depression, and meron din akong nakilala na ngayon hirap pa rin na i-cover yung ginastos nila, Madam Chair, dahil sa napakalaking gastusin sa COVID-19. Kaya nga matagal na nating sinabi, no, na napaka-ideal nga sana na lahat na treatment ng COVID ay sagutin, no, ng lalong-lalo na sa ating mga mahihirap, no? So we welcome that proposal, Madam Chair, and we are very much willing that the same be incorporated sa substitute bill na ihahanda ng ating Secretariat, Madam Chair.
Thank you, Kong Kaloy. Kong Joy, any reaction po doon sa aking recommendation? If your amendment, magdagdag tayo.
Alam nyo, Chairwoman, kahit na po anong idagdag natin, hindi naman sasapat talaga eh. Kaya kung ano man maidagdag po natin, idagdag na po natin sa galang natin kasi para sa akin, yun lang naman ang magagawa natin eh. Hindi naman natin madadagdag lahat ng yung kaya natin, dagdag na po natin lahat. Chairwoman, Madam Chairwoman, we cannot really I agree with you. I definitely agree with you.
Thank you, Kong Joy. May I ask, I think we have PhilHealth. Any comment about full risk protection? Ano ang thought and ano ang position nyo doon? PhilHealth? Anyone from PhilHealth? We have PhilHealth, di ba, Ma'am Sylvia?
Yes, ma'am.
Yes, anyone from PhilHealth? I think the PCEO is on board.
Good morning, Madam Chairwoman Helen Tan.
Yes po.
How do you read me, ma'am?
Comment po doon sa aming pinag-uusapan about dito sa additional benefits that we can give to our healthcare workers who suffered or who is suffering from COVID-19, whether it's mild, moderate, or severe and critical, doon sa expansion of coverage.
How do you read me, ma'am? Madam Chairwoman?
Yes po, loud and clear po. We can hear you.
Allow me, Madam Chairwoman, to read our position paper on House Bill number 10285, authored by Representative Angelina Natasiakpo, House Bill 10198, authored by Representative Joy Myra Tambunting, and House Bill number 10365, authored by Representative Luis Raymond Elre F. Villacorte Jr. Background of the bills. The proposed legislative measures propose COVID-19 benefits to health workers during the period of COVID-19 pandemic. The proposed benefits include special risk allowance and active hazard duty pay, life insurance, transportation and meals, and compensation in case of death or sickness. PhilHealth position. PhilHealth lauds the intention of the above-mentioned legislative measures and is fully supportive of the bill's intention. These bills do not directly affect PhilHealth since there was no mention or provision for social health insurance coverage of hospitalization cost of health workers who contradicted COVID-19. Nevertheless, PhilHealth provides financial risk protection to health workers since February 1, 2020. To date, PhilHealth reimbursements for full financial risk protection for health workers is at 12.56% of the total PhilHealth reimbursement for COVID-19 inpatient. In figure, that is something like 1 billion po. PhilHealth plans to continue this benefit during the duration of the national state of calamity due to COVID-19. The PhilHealth management is working with the PhilHealth board for the approval of the continued provisions of the full financial risk protection benefit for all health workers during the COVID-19 pandemic. The special benefit, however, is dependent on the available PhilHealth resources. Should the House of Representatives decide to include PhilHealth benefits on the proposed legislative measures, may we recommend that this will be for health workers with confirmed COVID-19 needing hospital admissions as what we have proposed in the Senate version of this bill. Respectfully submitted this representation. Thank you po, Madam Helen Tan, Chairwoman.
Thank you, Attorney Geran. I think Representative Stella Kimbo is raising her hand. Kong Stella.
Yes, Madam Chair, I have
Well, una sa lahat, Madam Chair, kaisa ako ng mga authors sa kanilang layunin na mabayaran ng sapat ang ating healthcare workers. So talaga napaka-importanting concern po ito. And also would like to manifest or express my my desire to be included as a co-author dun sa approved version po. But my question really has to do with the practicability of the proposal. Kasi syempre, ang gusto naman natin, ibigay natin ang amount na pinakakaya natin na ibigay, hindi po ba? So my question is, halimbawa sa DOH, magkano po ba ang total na resource requirement dito po sa kanilang proposal na singular allowance? So ang pagkakaalam ko based on previous hearings, we have 526,000 workers. Ano pong computation doon sa total resource requirement po? Tama po ba na it's about 50.4 billion pesos?
Yes, this is Dr. Vega, ma'am. Yes, you're right, 50.4 billion.
Okay, sir, thank you. And Madam Chair, doon naman po halimbawa sa version ng Makabayan Block, doon na lang po doon sa 15,000 per month na SRA, pag i-multiply po natin yan by the 526,000, ang kailangan natin dyan is about 94.7 billion. So ibig sabihin, talagang ang laki talaga ng amount na kailangan natin. So itanong ko na rin sa DOH, DOH, magkano ba ang inyong pinopose na amount for 2022? Tama po ba na ang pinopose niyo na amount ay zero? Hindi kayo nag-propose ng any amount for the 2022 GAB? Tama po ba?
Ma'am, we proposed before the NEP the same amount, 50 billion.
Hindi, yung in-approve pala ng DBM is zero. Tama ba?
Yeah, yes, ma'am.
Okay, so zero. And then, syempre, ginawa ng Congress ang lahat ng makakaya para makahanap ng pondo at ilagay dun sa approved version namin ng GAB. At tama po ba na ang nahanap namin is about 4.5 billion? So anyway, that's the amount, 4.5 billion. So sa ngayon, yan ang proposed amount for SRA for 2022. So yan ang tanong natin. In a situation na ang gusto nating ibigay sa healthcare workers ay way more than what is available, ano ang recommendation nyo kung paano siya i-prioritize or i-allocate? So ulitin ko po so kung ang mangyayaring budget ninyo is 4.5 billion for 2022 and then ang based on your proposal you need 50.4 billion at kung maipasa naman na version is yung sa Makabayan Block 94.7 billion para sa isang klaseng allowance lang yun. So ano yung solution niyo, proposed solution kung paano ang prioritization? Sino unang makakatanggap?
Yusek Vega.
Query for the DOH, ma'am. Yes, for Congresswoman Stella, ma'am. I think we provided the risk classification for the low, medium, and high risk categories, specifically for the healthcare workers, and this should be prioritized.
So ibig sabihin, i-prioritize niyo yung high risk. Tama ba?
High risk and medium risk and the low risk, ma'am.
Pero dun sa high risk, kulang pa rin yung 4.5, di ba?
Kulang, ma'am. Yes.
Okay nga. So yun ang tanong. How do we move forward? Kasi hindi naman kayo actively naghanap ng pondo. Tapos ito yung panukala ninyo. Hindi ba parang ang laki ng gap?
If the 4.5, that could be the prioritization would be in the high risk category. That's what you're asking.
So babalik tayo doon sa original proposal na may problema, which is doon lamang sa may direct contact. Yan ang inyong proposal. And Madam Chair, may we ask the representative from the Nurses Association, ano po naman ang kanilang pagtingin, no? So kung ang totoong sitwasyon is kulang ang pera at ang kanilang recommendation is dapat magbigay ng isang uniform allowance sa lahat. Meron ba silang recommendation kung ano yung magiging prioritization kapag kulang na kulang ang perang nakalaan.
Ma'am Abenohar or Mr. Mendoza?
Yes po.
Okay, yes. Go ahead.
Madam Chair, kami po sa Alliance of Health Workers ay inaayawan namin yung proposal ng Department of Health kasi ang nakalagay sa kanila is low, medium at high. At alam naman natin yung virus hindi namimili kung sino ang pipiliin mo, either doon ba ako dadapo sa high risk or sa low risk kasi lahat ng mga health workers entrance pa lang high risk ka na. So dapat hindi yan tama yung low, high at medium kasi ang virus hindi naman namimili kung saan siya dadapo at karamihan nga kahit sa PGH po mas marami ang nagkaroon ng COVID doon sa mga non-COVID area kumpara doon sa COVID area. Kaya nga nakita natin naman maraming mga may utang pa nga ang Department of Health ng kanilang meals, accommodation, transportation at active hazard duty pay from December 20 up to June 30 na nag-expire. Hindi pa nga nila nabibigay sa ngayon. Tapos sana i-review kasi hindi pa naman final yata po yung ating budget for GHAZI, yung ating NEP for 2022, i-review at yung proposal ng Department of Health doon kasi sinabi ng DBM na hindi daw ito prioridad ng Department of Health ang budget for the COVID benefits sa mga health workers kasi nung tinignan nila yung harapan, wala doon ang mga benefits sa mga health workers. Nandoon lang pala ito sa annex. So akala ng Department of Health, akala ng DBM, ito na yung proposed budget sa lahat. Pero doon sa proposed budget sa harapan ay hindi talaga nila binigyan ng prioridad ang COVID benefits sa mga health workers kasi nasa annex lang yan. Kaya na-mislook yata ito ng DBM kaya talagang hindi ito na-budgetan. Pero alam naman natin na ongoing pa yung ating budget deliberations sa Senate. Sana mahabol pa ito at mabigyan ng pondo talaga. At kung ano man yung pangangailangan natin, kunwari ay doon sa ating House Bill ng Makabayan Block 1 na nangangailangan ng 94 billion. So sana maihabol ito at bago magkaroon ng bicameral, madagdag itong budget na ito para mabigyan ng mga health workers talaga ng sapat na benepisyo. Kasi imagine, marami na nag-alisa ng mga health workers. Lumala ang understaffing. Marami naka-quarantine. Kaya instead na 16 hours duty ka or 8 hours duty, umabot sa 24 hours duty. At tingnan ng ating mga mambabatas din na saan kukunin ang mga budget na ito. Imagine, sinasabi sa top 10 ng mga ahensya, pang-apat ang pang top 4 ang Department of Health na budget. Pero kung titingnan natin, hindi siya pang top 4. Tumaas lang siya dahil nakadikit doon ang budget ng mga attached agencies ng PhilHealth. 79.9 billion ang PhilHealth. Kaya nung tinanggal natin yan, kasama ang iba pang mga nakatas, pang-8 na o pang-7 na lang ang Department of Health sa budget sa top 10 na yan. Kaya sana madagdagan ang budget talaga. Kasi imagine, pandemya, sa gitna ng pandemya, nagtatas ng mga budget. Yung ating mga GOCC hospital, tinanggalan ng budget, instead na doblehin ang budget kasi marami nangangailangan sa heart, kidney, lung center at PCMC. Ang lalaki ng mga kinautas ng budget, yung sa MOE. At saka alam naman natin na matagal ng panahon na yung mga pasahod sa ating mga GOCC hospital ay hindi na nanggagaling sa gobyerno. Pinabayaan na yung pasahod ng ating mga health workers sa GOCC hospital at saka yung capital outlay. Ang ibinibigyan nila ng gobyerno sa ating mga GOCC hospital ay 30% ng MOE. At in fact, ang dami-daming pasyente araw-araw sa OPD para maoperahan sa puso, operahan sa kidney. Pero iilan lang ang nabibigyan ng ating serbisyo dito sa mga GOCC hospital. Kaya sana tingnan ng ating mambabatas sa Senado po, saan natin kukunin. Napakalaki ang budget for the DPWH, yung build. Aanhin natin yung build. Aanhin natin yung mga gandang kalsada, mga flyovers, kung patay na ang mga Pilipino dahil binawasan ng budget ang ating mga pampublikong hospital at hindi binibigyan ng prioridad ang ating mga health workers. So yun lang po, Madam Chair, at sana ma-prioridad talaga ang budget ng kalusugan at the same time yung ating mga health workers para manatili sila sa ating bansa. Maraming salamat po.
Madam Chair, is it possible to hear from the Doctors Association? Kasi parang lumalabas is kapag konti lang ang pondong available, basta uniform lang, i-divide mo lang by the total number of workers. So ang lalabas po niyan, kung halimbawa 4.5 billion lang ang available, ang lalabas, napakaliit bawat tao. So I'd like to ask also yung doctors if this is a scheme that they find acceptable.
Dr. Benny Atienza, PMA President. Do we still have Dr. Benny?
Ako mukhang wala po, Madam Chair. So may I
Pwede
go
po
back?
ba, Madam Chair? Pwede po ba? From
Yeah,
the
no, actually,
nurses?
Madam Chair, I wanted sana also to hear from a doctor.
Okay.
Para lang kasi syempre, in terms of
Tawagin lang natin.
direct contact.
Nakita ko siya eh. Doc Benny, where are you? Andito pa siya. Dr. Benny, Atienza. Anyway.
Kasi Madam Chair, ang lalabas niyan kung 4.5 billion lang ang available funds, if you divide that by the 526,000 workers, ang lalabas 8,500 kada tao para sa buong taon. So napakaliit talaga. So of course, that's a situation on the ground. Pero
do you want to hear from DBM, although alam na natin sasabihin nila?
Wag na lang po, Madam Chair. I just wanted to hear sana yung lahat ng klase ng health workers natin. But anyway, siguro balik na lang po tayo kay DOH. Kasi yung bayanihan to, Madam Chair, under bayanihan to, we have different kinds naman talaga of benefits. Nandun yung SRA, active duty pay, nandun ang MAT, nandun din ang life insurance. Pero ang tanong ko sa DOH, ano nangyari kung bakit hindi napatupad yan, yung iba't ibang klaseng allowance? Ano ang naging balakid? Kasi halimbawa, ang pagkakaalam ko, hindi nakabayad ng kahit na ₱1 doon po sa life insurance. So may we ask kung ano-ano yung naging problema sa pagbayad and whether napag-isipan na nila kung anong solusyon para mapabilis ang bayad. And at the same time, baka pwede natin ilagay kung meron man certain provisions na kailangan idagdag sa bill para masiguradong mabilis ang pagbayad ng allowances.
Madam Chair, can we recognize ASEC Mylene Beltran to give a full rundown on the benefits provided for?
ASEC Mylene, you have the floor. Please proceed, ASEC Mylene. ASEC Mylene. Yusek, wala po si ASEC.
Good morning, Madam Chairperson. Maylene here po. Nandito na po ako, ma'am. Good morning po to our esteemed guests and of course our honorable congressmen and women. Ma'am Stella, Kong Stella, just to correct po, we were also able to give life insurance to around 32,000 healthcare workers, and they were enrolled in the Enhanced Group Personal Accident Insurance under GHAZI. So we've been really trying hard to provide the various incentives and benefits to our healthcare workers, and as we do recognize their valuable contribution. So, ma'am, siguro yung mga iba pa kung bakit hindi kami nakapagbayad on time na sinasabi, delayed yung mga ating mga pagbibigay, simply because there are some administrative issues po na hinaharap po natin, because we are actually providing the grants and incentives through our Centers for Health Development, and they deal po with various LGUs and private hospitals. So kasama na ho doon yung pag-prepare ng ating Memorandum of Agreement, yung ating kaukulang requirement for mga sangguniang bayan resolution, which would also facilitate the granting of all these benefits to our healthcare workers, especially at our operating units. So yun po, ma'am. That's why, as mentioned earlier by Yusek Vega, we wanted one COVID allowance just to make it easier and a bit more feasible for us to implement, na wala hong masyadong delays. Of course, we would want to minimize delays po. So yun po yung mga hinaharap po naming mga challenges as we provide benefits to our healthcare workers. Sana na-address yung issue or concern Kong Stella. Maraming salamat po.
Okay, so basically, singular allowance para mapadali. Basically, that's all right. And then number two, baka pwede kang, kung meron kayong recommendation as to language on kung ano mga exemptions na dapat on certain required processes, halimbawa mga sangguniang approval, etc. Baka naman pwedeng makapag-propose kayo para mapaganda palalo yung ating mga bills. Number three, since nandyan ka na, ASEC, pwede bang once and for all, malaman na natin, no? Ilan ba talaga ang nakatanggap na healthcare workers under Bayanihan 1 and Bayanihan 2? This is something that I've always been asking sa mga hearings at hindi pa namin talaga alam ilan ba talaga ang exact number at magkano ang average na natanggap ng lahat ng beneficiaries na to.
Okay, so we have a detailed data here. Thank you for asking that question. Kung dun sa Bayanihan 1, we were able to provide hazard pay to 83,917 healthcare workers. That would cover public healthcare workers for provisions of the law, Stella. And then for SRA naman, again under Bayanihan 1, we were able to provide a special risk allowance to 66,310 healthcare workers. That's only for Bayanihan 2, and that would only cover public healthcare workers, which the covered period of which is actually during ECQ and MECQ only. Okay. One-time payment din po yung special risk allowance. So yun po yung number of healthcare workers who receive this under Bayanihan 1. And then for Bayanihan 2 benefits, this covered 2 periods. The period from September 15 to December 19, 2020. And we have this particular data for active hazard duty pay, public healthcare workers only, 390,662. So, nandito po yung, if I may be allowed to share, Kong, ito na po yung na-share na po ni Justin yung aming slide. So ito na po, Kong, yung aming mga data. Again, maraming salamat po for allowing us to share. So,
Madam Chair, just a clarification. Hindi ito unique individuals.
These are not unique individuals.
So, yun ang tanong ko. May unique count ba? Question. Ano yung
definitely kulang po yun.
The granting of said benefits, hindi na pwede sila maghintay. Anong lagi ng paulit-ulit natin sinasabi, no? Aanhin pa ang damo kung patay na yung kabayo. So we hope that this proposal be also integrated in the granting of the timeliness of the benefit for our health workers. Salamat po, Madam Chair.
Thank you, Kong Gaite. Just want to inform the body that the Senate has already approved same proposal, no? So, can we, Kong June?
Madam Chair?
Okay, can we hear a motion for the consideration or approval of this bill?
Madam Chair, I move to approve in principle House Bills 9640, 10198, 10285, 10331, and 10365, subject to consolidate its style and amendment. I so move, Madam Chair.
I second the motion, Madam Chair.
There's a motion to approve in principle House bills we discussed earlier, subject to consolidation and amendment and style, duly seconded. Is there any objection? Hearing none, the motion is approved. Congratulations to the authors.
Thank you, Madam Chair. Thank you to our colleagues as well as the resource persons.
Thank you so
Madam
much.
Chair. Madam Chair.
Congratulations po.
Salamat po, Madam Chair.
We'll now proceed on item number. We'll now proceed on item number. Where is
Madam
it?
Chair.
Number.
Madam Chair.
Mr. Mendoza, short lang po kasi we're running out of time.
Yes, ma'am.
Madam Chair, maraming salamat po doon sa ating hearing po regarding sa mga benefits ng mga health workers. Pero hingi po kami ng tulong po sa inyo kasi marami pa pong utang ang Department of Health doon sa usapin ng meals, accommodation, transportation at saka active hazard duty pay from December 20 up to the June 30. Wala pa rin po silang ginagawa para maibigay ito sa mga health workers. Magpapasko na po at inaantay ito ng ating mga health workers. Sana ma-follow up natin kailan ba yung time frame bago magpasko ba ibibigay ang mga benefits na ito, yung MAT, yung active hazard duty pay. Madam Chair, maraming salamat. Sana both public and private matutuwa po siguro this coming Pasko para maibigay itong mga benepisyong ito. Maraming salamat po.
Thank you, Mr. Mendoza. We'll definitely follow up sa DOH. Anyway, on board po si Yusek Vega and Sec Mylene Beltran. Kindly update po yung committee on the status of other benefits that's supposed to be given to our healthcare workers under Bayanihan 2. COMSEC, paki-coordinate sa DOH, no, and will feedback ang ating mga organization, professional organizations on the status. We'll now proceed on item number 7, which is the updates on PhilHealth Circular. Circulars and commitments on House Resolution number 1966 as deliberated upon by this committee last August 17 and 24 and September 1, 2021 meetings. May we hear from President Geran, Attorney Dante Geran, RP CEO, or anyone from PhilHealth who can provide us an update. Attorney Geran.
Chairwoman,
Okay,
Helen Tan, may we ask Your Honor if what specific policy would you like us to update on?
Sir, from last hearing natin, di po ba, we discussed that circulars ng 2021-008 2020-009, the TSPC, and then nagbigay po kayo ng commitment noon, or we asked for commitment to fix yung confusion created by these circulars, no? As stated in my opening remarks earlier. Meron po tayong mga itinanong sa inyo doon about for a while po doon sa confusion created by the the circulars wherein you talk about the confirmed and probable, and then you came out with the confirmed and intermediate packages, no? So ano po ang updates na action regarding that issue?
Thank you, Madam Chairwoman Helen Tan. We have here the TSPC updates, which will be presented by Dr. Lambert David, and then we have also the NBB, rather the revision of the coverage of COVID-19 inpatients, which will be discussed by Dr. Clem Bautista. Madam Chair, we will first hear Dr. Lambert David on the TSPC updates. Madam Chair, let's recognize Dr. Lambert David.
Dr. David?
Yes, Madam Chair. Good morning po. Permission to share, Madam Chair.
Go ahead, sir.
Good morning, Madam Chair, and to the honorable members of the Committee on Health. So I will present the updates on the temporary suspension of payment of claims circular revision, or the TSPC revision. So just a quick background on the TSPC. So TSPC is the conditional stoppage of payment of claims for claims undergoing investigation. It is not a penalty but a preventive measure to avoid loss or wastage of funds due to fraudulent acts, unethical acts, and abuse of authority. The legal basis of the TSPCA are the IRR, the National Health Insurance Act, RA 7875 as amended by 9241, RA 10606, and RA 11223, in which all completed claims, except those under investigation, shall be paid within 60 calendar days from receipt of the corporation. Secondly, PhilHealth rules on administrative cases or PRO Act involving healthcare providers, members, and field employees states that the fact-finding investigation enforcement department or the PhilHealth regional office shall recommend temporary suspension of payment of claims and or withdrawal of accreditation contract in accordance with the policy issuance of the corporation on the existence of fraud, abuse of authority, and unethical practices of a healthcare provider. And lastly po, the COA rules on updated guidelines on the prevention and disallowance of irregular, unnecessary, excessive, extravagant, unconscionable expenditure, or IUEEU, states that emphasizes the policy that government funds and property shall be fully protected and conserved. IUEEU expenditure or uses of such funds or property should be prevented. So that's just an overview of the legal basis for TSPC. These are the chronology of events. So December 12, 2018 po, PhilHealth Circular 2018.
This COVID disease is...
Yes, ma'am, we did po.
Okay.
That Mr. Geran and PhilHealth are also listening to us, and we are working closely with them for the good of the majority of our doctors and patients. Thank you, and that's all, ma'am.
Thank you, Dr. Okay, clarify ko lang po kay PCO natin. Number one, doon po sa discussion natin based on your circular approved last June 17, June 8, I think. June 17, 2021-008. Ito po yung naging subject of discussion natin on the retroactive effect of that circular. And based on our discussion, ang recommendations of the members of this committee and observation, bakit ginawa niyong retroactive, hindi siya prospective ang application. And still, with the recently published Circular 2021-0020 as presented by Dr. Glenn, still hindi siya prospective, no? Ang nakalagay pa rin po dito, ang scope ninyo is this PhilHealth Circular shall apply to all Filipinos who are admitted, in accredited hospitals starting November 26, 2020 and being assessed and or managed as COVID-19. Can you clarify that, Attorney Geran?
Madam Chair, this is to clarify that the policy was still in effect, only grace period was granted by the board. So the effect of that is it is not applicable to claims from November 26 to June 18. Only after the publication of the circular, which is on June 19, that we will start implementing the package and the confirmed paying only the confirmed cases in the intermediate package. Madam Chair, what we
Yes.
hear is
Yung intermediate package was applied retroactively to benefit those who will not qualify for a probable case or those which were managed as COVID-19?
Madam Chair, what will happen po is because there's a grace period, whatever is the policy from the previous policy, 009 will be implemented until June 18. So wala pong intermediate during that period po. What will prevail during
Sabi ko wala tayong intermediate package from 2020-009 circular up to 2021-008, which is June 17. Am I clear?
Yes, Madam Chair.
Dr. Glenn, ang gulo ng statement nyo sa yung recent circular Sana straightforward kayo na nagsabi na ganon. Wait, hahanapin ko lang. Ito, meron kang transitory clause na nakalagay dito at yung na-mention mo na grace period. Bakit hindi mo na lang sinabi dito sa circular, bakit hindi na lang nyo inilagay na katulad ng na-mention mo kanina, na from that circular ng 2020-009 to June 17, wala tayong intermediate package. At ang intermediate package will be applied from June up to dito sa prospective application na tayo. Tama? Dr. Glenn?
Yes, Madam Chair.
Tingnan mo po babasahin ko sa iyo. Ang sinabi niyo sa transitory clause, a grace period shall be given for the inpatient claims of probable COVID-19 pneumonia cases admitted from November 26 to June 18. O ano po ibig sabihin ng grace period? Binibigyan mo sila ng pagkakataon na mag-file at i-claim based doon sa kung anong nakasaad sa circular nyo ng 2020-009. Tama po?
Yes po, Madam Chair.
Kasi nakalagay nyo po number 2, starting June 19, date of admission. Only cases with positive RT-PCR test results or those that fulfill the criteria under Section 5C of this PhilHealth Circular shall be eligible for COVID-19 inpatient benefit package, while cases initially managed as COVID-19 but with negative RT-PCR test results are eligible for intermediate package until the publication of this recent circular. Dr. Almora, hindi po ba kayo nako-confuse dito?
Yes, I agree with you, Madam Chair. It's quite confusing. Apparently, they refuse to withdraw the circular that is creating a retroactive effect, so that they use the word grace period to avoid withdrawing that circular.
Sinasadya nyo bang gawing confusing ang mga circular para tayo lahat ay mahirapan? Pwede namang straightforward po ninyong sinabi na ang intermediate package will be effective from June 19. Wala ka nang binanggit na November 16. Yung probable and confirmed ang magiging basis ng claims from that circular 2020-009 dated April 8, 2020 up to June 19, 2021. Hindi ba pwedeng ganun ka straightforward?
That was the initial proposal, Madam Chair, but I think the preference of the board is that we use the grace period.
Madam.
Attorney Garan, how can we reconcile yung mga confusions? Again, I thought mas nag-improve yung ating circular na issue ninyo. Kahit ako, pabalik-balik ko pong binabasa, yung lahat ng mga circulars, nakakalito pa rin siya. So, from the end users natin, yung mga partners natin na mga hospitals, sila magko-confuse sila yung interpretation doon po sa inyong recent circular. Ito pong 2021-0020. Malinaw po, sinagot ni Dr. Glenn, wala tayong intermediate package until June 19, 2021. Pero may nakalagay po kayo dito sa transitory clause. Okay? Nakalagay po dito until nga po this PhilHealth circular is published, which is ito pong pinaka-last natin is October 31, 2021, sir. So, hindi po ba nakaka-confuse po yun para sa ating lahat yun?
Madam Chair.
Payments again, sir. Yung interpretation, I think, ang nagkukos ng pagbagal ng pagbabayad. Nagbabayad nga po pero mabagal dahil nga po doon sa confusion ng inyong policy. Sige,
Madam
sir.
Chair. Madam Chair, what is important is the intention po. And the intention is there is no more such mammal as what we call this intermediate package. And if it is desired by this committee, Madam Chair, we will issue a clarificatory advisory on the matter, Madam Chair.
Okay, sir.
To erase all doubts, Madam
Thank
Chair.
you po. Thank you, sir. So, nandyan po ang ating mga colleagues and PHA, you will clarify this. Yung na-mention nyo po, there is no mammal. Nandito po, nakalagay po. Nakalagay po yung intermediate package sa recent ninyo na circular. Ako, I was expecting that the effectivity of your circular will be from the recent, kailan yung publish nyo? October 31? So sana effective October 31, 2021 onwards, the reference will be that recent published circular. So October 31 onwards po, that's when you're going to implement the confirmed and the intermediate package. Ang naging dahilan, I think, kasi nakita ko po kanina doon sa presentation ni Dr. Lambert, ang ginagawa nyo, nagda-draft po kayo, and then after drafting, subject to consultation to stakeholders. If I may suggest lang, President, baka po pwede pong unahin nyo ang consultation with stakeholders before drafting. So after drafting, again, you'll present it to stakeholders subject to improvement and siguro consolidation ng mga recommendations. Mr. President?
With respect to the matter, Madam Chairwoman, whatever actions that we have here, after consultation with our stakeholders, the matter will eventually be submitted to the board for final approval.
Okay. Kaya lang, sir, ito pong 2021-0020, approve nyo na po and publish October 31, no? And na-mention naman ni President Almora, marami pa rin na sila na inaasahan for improvement. And ako personally, nung binasa ko po ito, which is galing po ito sa inyo thank you so much for providing us an updated circular. Ito po yung binigay ng inyo pong tanggapan sa aming committee, no? So, yun po yung isang observation. Second po na observation, bago po kayo ng definition ng probable. Tama po? Ang nakalagay dito, siguro si Dr. Glenn, ang inyo pong definition ng probable, based po doon sa 2020-009 PhilHealth Circular, a probable case defined as a suspect case who fulfills any of the following. Number 1, suspect case whom laboratory testing for COVID-19 is conclusive. Suspect who underwent testing for COVID-19 but not conducted in a national or subnational reference laboratory or officially accredited laboratory for COVID-19 confirmatory testing. And number 2, or suspect case for which testing could not be performed for any reason. And then, dito po sa bagong published circular 2021-0020, you define probable case as a patient who meets clinical criteria for a suspect case and is a contact of a probable or confirmed case or epidemiologically linked to a cluster of cases which has at least one confirmed case identified with that cluster. Number 2, a suspected case with chest imaging showing findings suggestive of COVID-19 disease. Number 3, a person with recent onset of anosmia or loss of smell or agnosia or loss of taste in absence of any other identified cause. And number 4, death or otherwise explained in an adult with respiratory distress preceding death and who was a contact of a probable or confirmed case or epidemiologically linked to a cluster which had at least one confirmed case identified within that cluster. So, ang tanong ko po, kailan po mag-a-apply? Although may question po ako sa definition nyo ng probable case under this recent circular, kailan po mag-a-apply itong definition na ito na inadapt nyo galing po sa Department of Health?
Madam Chairwoman, it's very technical. May I respectfully refer you, Madam Chair, to Dr. Mary Antonietta Remonte po for clarification.
Okay. Dr. Remonte, Dr. Antoinette.
Good morning, good afternoon, Madam Chair. The case definition was published by DOH November 26 po, 2020. So timing po. And we thought it's more, because it doesn't mention any more of the COVID RT-PCR test. So that is, and it's more specific po in terms of defining yung probable to guide our evaluator. So yun po yung inadapt na definition sa probable. Halos pareho rin po in terms of symptoms, epidemiologic criteria. So mas madali po siyang i-evaluate kasi yun po yung isang issue, yung evaluation. Now, as to the applicability ng circular, because po hindi naman talaga yung sinuspend yung decision to pay only RT-PCR confirmed case, we extended po yung coverage ng probable from yung na dapat November 26 ay hindi na siya covered. So in-extend po siya from November 26 to June 18. Kung kailan na-publish kasi yung circular ng June 19. So doon na lang po, ang i-cover na lang po is yung date ng publication ng circular 008. Now, as to the intermediate po, kasi may mga po kasi sa aming issuances na guidelines, doon po siya, kaya po siya doon nilagay sa transitory provision po. Then, yung intermediate kasi, may mga claims po na na-process na ng intermediate. Kaya po, hindi rin namin siya matanggal. Otherwise, meron na po kasing na-implement na, may mga na-implement na pong benefits na intermediate. Now, pwede po sila ngayon i-adjust. Pero hindi po siya matanggal dyan because meron nga pong, it will add naman po doon sa aming, sa more confusion naman doon sa sa claims. Pero ang intention po talaga from November 26 to June 18, yung probable COVID-19 pneumonia ay ipaprocess na as for inpatient. Kaya po lang nilagay na eligible because there are still mga dapat pang i-follow, i-process na mga rules sa processing, etc. Pero yun po yung intention, i-cover po or i-process yung mga claims ng probable COVID pneumonia from that period. So kung meron pong we will issue po yung advisory, then meron po rin pong nire-ready po namin yung tamang sagot para mas po siya, mas ma-explain doon sa mga stakeholders.
Okay, clarify ko, Dr. Remonte ha, kasi naka-record tayo or makikita naman to sa minutes of the meeting. You said November 26, yung sa definition the new definition, okay, na ginamit ninyo, in-adapt nyo yung sa DOH, tama? November 26, okay? And you said, tinanong kita, so ano ang magiging basehan ng definition ninyo ngayon? You said, kailan i-apply, no? Application. And you mentioned June 19.
Ay, yung definition po ng
yung bago po yung definition ng probable case. Kailan po yan gagamitin?
Okay, para po sa claims ng November 26 to June 18, kasi po yung June 19, wala na nga pong probable, confirmed na po lahat yon.
Di nga, yun nga yung pinagtalunan natin last time na bumalik tayo doon sa ating issue. Ang issue natin, nung in-issue nyo ng June 19 or 17, 2021, bigla kayong nag-retro ng November at ipinasok nyo ang intermediate, di ba? So ang minention namin sa inyo, bakit naging retroactive siya, hindi siya prospective. So ngayon, biglang binago nyo naman ang definition ng probable. Inadapt nyo yung bigla na sinabi nyo na definition ng probable ng DOH, which is malaki ang impact nito ha. Ang gusto kong tanungin, paano nyo binabalidate, paano nyo nagagamit? For example, sinabi dito a patient who meets the clinical criteria, madali lang yon, or epidemiologically linked to a cluster of cases which has at least one confirmed case identified with that cluster. Paano makikita sa mga sinasubmit na documents ng mga healthcare facilities etong justification na to? Wala. Saan nyo nakikita? Sa CF4, wala namang makikita na may sinasabi na ganon. Number 2, sinabi nyo, with the recent onset of anosmia, subjective to. Sabihin ng pasyente, nawalan ako ng amoy. Sabihin ko na lang palagi, nawalan ako ng amoy. Kahit hindi naman pala ako nawalan ng amoy para lang makover ako ng PhilHealth. So, paano nyo i-validate to? Kasi yung clinical, okay lang yon, walang problema kasi na-i-attach yun. Pero yung sa sinasabi nyo na at least one confirmed case, yun ay pwede nyong basehan. Paano nyo ito i-validate pag magre-review kayo ng claims ng mga healthcare facilities?
Sa history pa rin po, Madam Chair.
Kung nakalimutan sabihin ng doktor sa history, hindi niya na-mention yon.
That
At
is why
wala din naman nilagay na loss of appetite and loss of smell.
That is why po we emphasize po yung yung history, na yung salient features mailagay talaga siya sa CF4 or sa clinical chart para maiwasan na po yung yung miscommunication. So yung salient features po, i-document na po siya sa sa chart.
Sa history kasi hindi naman sinasabi, yung sinasabi natin dito na epidemiologically linked to a cluster of cases, hindi niya masasabi yon. But yung subjective na sinasabi ng pasyente, yes, mailalagay niya yon. Yung loss of smell, loss of taste, masasabi niya yon. Ang sinasabi ko, yung adapting to at least one confirmed case identified with that cluster. Okay? Sa report lang po yan ng DOH, pero hindi po nire-report yan doon sa, I don't think may pagkakakitaan ka dyan sa chart ng pasyente. So yun yung isa ko na question dito sa pag-change nyo po ng definition ng probable. And then, i-adapt nyo siya from November 26 up to June. Again, problem na naman yan, Dr. Ramonte. Kasi, nagbago kayo bigla ng policy. Noong una, ang basehan nyo, yung 2020-00. So how can you reconcile yung confusion doon?
Okay.
Tayo na review yung dati.
Madam Chair?
Oo.
Pardon po.
I-review nyo ulit lahat ng probable.
From November 26 po, we we will check ulit yung definition ng old, but naman po siya, nandun din siya sa new definition actually, pero mas clear lang po yung mga lalo na yung clinical criteria, Madam Chair.
Doktora, walang problema doon sa clinical
Opo.
criteria. Kasi dito sa 2021-0020, you mention policy statements. You even mention letter C. PhilHealth shall accept results of antibody tests done in hospitals or DOH licensed laboratories as adjunct test for diagnosing COVID-19 if all of the following criteria are met. No? Ang minensyo ninyo antibody test, babalik ako, I remember, tinanong ko ito last hearing, saan nyo nakuha ang antibody test as reference considering 2022, 2021 na po ito. Yung naalala ko may isang doctor sa inyo sumagot sa akin na ang basehan yung HTAC. Then I called up HTAC. Wala silang ganyan. Kinorek na nila yan na ang basis is antigen test, not antibody test. Also again, nandito sa policy statements nyo, letter C. Do you have the circular, Doctora, if you can read? Question, why antibody test, not antigen test?
Ang antibody test po dyan is an adjunct for those with negative RT-PCR po. Yun po yung nandun, kasi hindi naman po siya as confirmatory. Adjunct.
Bakit nga antibody not antigen ang adjunct na ginamit ninyo? Ngayon, vaccinated tayo. Experience namin, wala kang symptoms, pupunta ka, attend ka sa meeting, you are required to undergo test. Natawa ako, ginagawa nila antibody test. Siyempre, lumabas doon positive. Pagkatapos, pupunta na naman ako ng antigen. And on recording ng ating mga positive cases, inadapt na ng DOH ang antigen positive cases. Ina-add na nila yan ngayon sa reporting nila. So mukhang hindi tayo naka-align doon sa anong policies of the DOH and your policy. So kahit adjunct siya, Doktora, bakit antibody ang adjunct? Yun ang question ko, not antigen test.
Okay. Kasi po yung, nakaano po kami doon sa approval nung November nga na RT-PCR yung accepted na confirmatory test. Then yung antigen
paulit-ulit tayo. Yes, talaga namang RT-PCR confirmed positive. Ang HTAC nag-issue noon pang, I forgot the date, pero nung tinanong ko ito, doon sa kanila, sinabi nila, ma'am, last year pa kami may issued policy
antigen.
na antigen ang ginagamit. Ang
Yes po.
tinatanong ko, bakit ito, 2021, October 2029, approved, bakit antibody ang nakalagay? Hindi November policy kasi hindi na yun ang policy ng DOH. Binubuklat nyo ba lahat ng policy ng DOH? Nire-review nyo ba?
Opo. Yung antigen
I don't think so. Hindi nyo nire-review lahat. Kasi itong circular na to, napakagulo ng inyong pagkakagawa. So ito, babalik ako sa DOH tatanungin ko uli sila. HTAC mismo ang aking tinanong nung last hearing natin. Kailan tayo nag-hearing? June. June ba tayo nag-hearing? Yung last 2 hearings natin, I think June yan. Nagtanong ako sa kanila and sila mismo ang nagsabi sa akin. Si ASEC Charade mismo ang nagsabi sa akin, ma'am, no. Malinaw po sa policy namin, antigen po ang nakalagay doon sa HTAC. O so hindi nyo po ni-review yan.
Okay. Madam Chair, yung sa policy po ng antigen as confirmatory, ito po ay ano po siya, for revision kasi yung COVID policy. So, nandun po siya sa proposal namin, yung antigen.
Ako hindi ko na ano yung sinasagot mo sa akin. President, ikaw na lang po. At tayo pabalik-balik dito sa ating pinag-uusapan. October 29 po, naglabas kayo tapos nire-review nyo pa pala. Bakit po kayo naglabas ng nire-review? Alam niyo po, kaya ako na medyo parang para tayong paulit-ulit sa ating pinag-uusapan. Madaming pwedeng pag-usapan po sa committee nito, pero dahil nga lang po doon sa balita na maraming hospital na magdi-disengage doon po sa PhilHealth as accredited facility, alam naman natin ang impact niyan sa sambayan ng Pilipino. Iniiwasan natin, tinutulungan natin, kami po ay venue to reconcile ano ang pwedeng pag-usapan at isaayos sa polisiya that is beneficial to both from PhilHealth at saka po doon sa healthcare policies natin. So, venue po ito. Pero it seems na itong policy ninyo na nilabas na bago, may mailabas lang po kayo pero nag-create na naman ng mas malalim na confusion. So yun po yung aking, kaya medyo nakakainis din on my part kasi binibigyan namin ng oras pero parang hindi naman nag-i-improve. Mr. President?
Yes, Madam Chair.
Na lang po, sir, I will write po siguro in writing, ipadala ko po sa opisina ninyo ano yung mga observation ninyo and just tackle it with the board, no, and stakeholders siguro. Hingin ko din yung galing po sa kanila sa PHA and then discuss it. Ano lang po ito, parang kung gagawa po kayo ng policy straightforward, madaling intindihin. Parang effective November ba yan or June? O di wala na tayong, or October. Wala na po tayo. Gagamitin nyo po ba ay intermediate na and confirm or magpa-probable pa po ba tayo? So hanggang saan lang po ang probable? Kasi malinaw, sinabi kanina ni Doktora, yung nauna po kay Doktora Rimonte, yeah, nawala na po kayong gagamitin na intermediate, no? Gagamitin nyo siya June pa lang, pero hindi nga po ganun ang nakalagay sa transitory clause ninyo. So maging straightforward na lang po kayo doon sa paggawa ng polisiya and update nyo po aligned with the policy of the DOH. So ang question ko, paano nyo po ni-resolve yung probable cases before? Or baka i-resolve pa lang lahat kaya delayed po yung payments?
Madam Chairwoman, Honorable Helen Tan, we will just wait for your communication and then we will make we will make a push, what we call this a review and go back to the board again for finally to make a final and clear statement or circular advisory rather on the matter.
Thank you, Mr. President. Meron na po bang nakaupo na representative ang Philippine Hospital Association sa board? Baka currently meron na pong nakaupo.
Don't have, Madam Chairwoman?
Meron na po na representative ang Philippine Hospital Association sa board. Kasi nasa UHC law po yun na dapat represented po sila. Last meeting, sir, ang na-mention po ninyo, wala pong representative. Nung last meeting po, I think Secretary Duque confirmed that na wala pong representative. Baka lang po, through you, being the president, if you can push po, kasi yan po ay mandated by law under the UHC.
For me, Madam Chairwoman, to make that what we call this proviso, it's with the office of the President, Madam Chairwoman.
Dr. Almora, anong development po doon?
Yes, Madam Chair. The provision of the Universal Healthcare Law is for representative of the healthcare providers, meaning the hospitals and the professionals. There is one representative in the sectoral sector to be recommended by the healthcare providers. So that should be implemented 30 days after the effectivity of the Universal Healthcare Law. But so far until now, Madam Chair, there is no board that the members of the sectoral, the expert, and the ex officio members of the board should be presided over by the GOCC. But it's not been implemented yet, and so we do not have yet a representative that we have endorsed, Madam Chair.
Woman?
Yes, Mr. President.
Helen Tan, Madam, we have a retired Armed Forces of the Philippines Brigadier General Marlene Padua as representative of the healthcare provider sector right now. As member of the board, Madam Chairwoman.
Okay, sige po. Sino pong nag-nominate sa kanya? Kaya? Dr. Almora, member ba siya ng ng PMA or PHA?
We did not. I have no knowledge, Madam Chair, that there is a recommendation coming from either the PMA, the other healthcare professionals, as well as the Philippine Hospital Association and the Private Hospital Association of the Philippines, Madam Chair.
Anyway, Mr. President, sir, yung representative po ba is a doctor?
She is a nurse, Madam Chairwoman.
Okay, sige po. Thank you so much. May clarify. So, ang commitment niyo po, sir, is to review again this recently published circular. Tama po?
Yes, Madam Chairwoman.
Okay, thank you, sir. Thank you so much po. We'll send you po yung comments. Ang next question ko po is regarding sa na-raise po ni Dr. Almora under 2020-009 circular regarding on the general guidelines letter C on your policy for no co-payment. Okay, ito po yung mga COVID cases natin na hindi pwedeng mag-out of pocket ang ating mga pasyente. But nakalagay po doon, patients can have co-payments for amenities such as suite room accommodation. So we all know na ang ating pong mga COVID patients are admitted in a private room. Tama, Dr. Almora? Kasi isolated siya.
Yes, Madam
COVID
Chair,
patient in a single room.
the Universal Healthcare Law allows payment of co-payment from patients admitted in the
Yes.
private hospital and outside in the non-basic ward.
Okay.
However, the 200-009 did not qualify. It's just made this general statement that no co-payment for COVID cases. So that makes that is the confusion, Madam Chair, because this is not inconsistent with the provisions of the Universal Healthcare Law.
Okay, thank you so much. President, I think that's one of the pressing problems now of healthcare providers natin. Doon po sa Circular 2020-009 on the no co-payment. Kasi current, ang naka-mention nyo lang po, such as with room accommodation. So parang pwedeng mag-charge lang sila pag naka-suite room sila. Siguro may refrigerator, may television, may aircon, and other amenities. But doon sa UHC, ang NBB is yung basic accommodation, which is yung ward natin, no? Ibig sabihin, shared room siya. Shared room siya. So, how did you reconcile po yung policy na to doon sa UHC law?
Chairwoman,
With the advent of COVID-19.
May we recognize again Dr. Glenn Bautista.
Dr. Glenn?
Good afternoon again, Madam Chair. I would just like to clarify po na you're correct based on the policy on COVID-19 as from Circular 009. It was stated that there shall be no co-payment for COVID packages except for amenities. And to this, we'd just like to clarify that when we refer to amenities, these are features of the health services that provide comfort or convenience, such as private suite room accommodation, air conditioning, telephone, television, and choice of meals, and additional features in the room, such as microwave oven, refrigerator, safety wall, and other services po, such as private duty nurse, additional pillows, linens, newspaper, deliveries, among others, are also considered amenities. Meaning when these are provided for by the patient, by the hospital or requested by the patient, this should be subject to co-payment. But this has been in effect for COVID-19 for 009, but when we issued for the circular on the modification of the COVID packages, wherein we pay po yung pay whichever is lower, what is in effect now starting August 22 is we revert back to the NBB policy, wherein this time po yung NBB po, meaning there should be no balance billing for certain sectors of the members or groups of PhilHealth members, like yung kung mga kasambahay, mga indigents, senior citizens, ito lang po yung mga kaabil ng NBB, and this shall apply to government hospitals. Yun na po yung current policy natin. So, at mag-a-apply na po yan starting August 22 claims.
So, Dr. Glenn, in general, no, hindi na specific na kung COVID ka, no out of pocket. Okay na siya. Kasi ang what I'm raising to you is yung nakandoon sa 2020-009 policy ninyo na sinabi ninyo na walang co-payment.
Yes, ma'am. Yes, madam.
That will be effective August 22, 2021. In general, babalik tayo doon sa NBP, yung senior citizen natin under the mandatory PhilHealth coverage, yung indigents natin, 4Ps. Diba? Ito yung mga NBBs natin before.
Kasambahay.
Okay, kasambahay. So eto na, sa COVID-19, wala na itong policy na no co-payment.
Yes po, starting August 22 po.
Did you issue a clarificatory statement on that? Wala po.
There's an issuance of the circular. This is covered under policy on the PDEA, which is the
yung whichever is lower po na nakasaad.
Yes po.
Wala po doon.
That's PC 2021-0012, Madam Chair. That is that provision is incorporated to the bond.
I-check, pinapacheck ko lang, Dr. Glenn, kasi wala akong nabasa doon na yung implementation natin at hindi na nagte-take effect itong 2020-009 ninyo na statement dito from August 22. Okay, anyway, chine-check pa ng staff ko. Another question. So malinaw yon, Dr. Almora, na yung from August 22, 2021, yung implementation ng NBB is for those stated in existing laws, no? At saka align po with UHC. Paki-check naman kung may sinabi tungkol doon sa mga kasambahay, mandatory. Okay. And clarify ko lang to, Dr. Glenn. Under 2020-009 din ha, on letter B, benefit availment, kasi ito issues raised by the Chief of Hospitals from the government hospitals, especially level 1. Ang nakalagay dito, on the second sentence, level 1 healthcare providers can only provide services for mild pneumonia package, except when there is no other higher level of facilities that can accommodate the surge of patients within an area for the inpatient case management of moderate pneumonia. In reality, sa mga probinsya, para sa kaalaman po ng mga taga-PhilHealth, ay wala talagang pasyente, wala talagang mapuntahan ang ibang pasyente. Katulad nung nag-hearing tayo kanina, sa isang 11 municipalities, wala silang access to a level 2 hospital na malapit sa kanila, all level 1. So with COVID-19 from March onwards up to this time, talagang ang mga pasyente, because mostly are poor, nag-TTS, hindi talaga, kahit i-advise sila na lumipat, hindi sila lumilipat. So, minamanage talaga siya ng mga level 1 hospital. And then, they informed me, you denied their claims. No? So, na-deny na yung kanilang mga claims because of this policy. Dr. Glenn, paano natin sila matutulungan about that?
Madam Chair, if I may again po. That policy, actually, yung rationale naman po doon is that, of course, we have to take into consideration the license of the hospital, which actually reflects or speaks of the capacity of the hospital. What level they should be able to provide or what level they are licensed to provide. So, yun po. And since these level 1 hospitals do not have an ICU capacity, and as we all know, for severe and critical cases, we actually need these services, no, or upgraded capacity. However, we can naman pay. We don't really deny claims that are coming from level 1 hospitals, COVID claims, but as per the circular, we can pay po up to the moderate. As an update, up to the moderate case. As an update po dyan, since there's already now licensing by the DOH for level 1 hospitals as temporary ICU facilities, we will be considering this license cost. So if any of the hospitals providing care for severe and critical cases has a license as provided for or granted by the Department of Health to be temporary ICUs, then we can pay for severe and critical cases in these hospitals. Madam Chair, that is the plan of the PhilHealth, and this is due for approval po and for presentation to the board this week.
Thank you, Dr. Glenn. Actually, in real world, dapat ganon. No? Kung anong level ng classification mo, based on your capacity, ganon dapat. But sa real practice, Dr. Glenn, pag pumunta ka, hindi naman pinababayaan ng mga hospital siya, humahanap sila ng paraan. No? Paano i-manage yung mga cases natin. Marami sa moderate cases natin due to surge. Wala, minanage siya doon sa hospital. Nakatuwa yung iba kahit hindi na ICU, nakasurvive. With high flow oxygen lang or just an oxygen, they were able to surpass the problem, no, on COVID-19. But the problem is, dinideny na ng PhilHealth, no? So yun yung kanilang denied yung kanila kasi moderate. Hindi naman nila dadayain yung kanilang diagnosis moderate pa rin. Level 1 hospital ka, they file for moderate cases, denied automatic. You can check that in your regional offices. So yun ang question ko. Tingnan nyo yung reality ng situation in the ground, no? So sabi ng mga chief of hospital sa akin, paano naman ma'am kami na-provide namin, gumaling ang pasyente, ito yung moderate cases, hindi na ilagay sa ICU but we're able to survive, no? Deny ang case, hindi babayadan. And alam natin, nag-incur na expenses to a healthcare facility. Kahit pag government yan, alam nga natin, hindi kayang i-operate ng mga local government units ang mga hospital nila, nahihirapan sila. But deduction yun sa income supposed to be to support pa yung iba pang mga pangangailangan ng hospitals. So, kindly idagdag po natin ito to check because in your circular 2021-0012, babalikan ko po yung NBB. Wala pong nakasaad dito na kinlarify nyo yung sa NBB implementation, ang minimension nyo dito, whichever is lower, yun ang babayadan ninyo. Pero hindi nyo po binention dito na babalik tayo doon sa NBB policy natin that we implemented based on the existing laws like yung senior citizen, kasambahay, 4Ps natin, and yung under Universal Healthcare Law. So please check po yung August 2022 circular. Babalik po tayo dito sa Committee on Health kung ano na pong action na ginawa ng PhilHealth on those issues. Do we have members who wish to ask questions?
Madam Chair?
Yes, Dr. Glenn.
If I may po, dun po sa circular namin na 2021-0012, ito po yung pay whichever is lower, no? It is stated po dun talaga sa section 5, policy statements, letter C.
Policy statement letter C. Wait, I'll check. Okay.
Nakalagay po dito na no balance billing policy based on PhilHealth Circular number 2017-0017 entitled Strengthening the Implementation of the No Balance Billing Policy Revision 2 shall be applied until revised or amended.
Okay.
So, doon po siya.
So ito yung sa mandatory natin na NBB. Yung statement nyo about doon sa COVID-19. Silent po kayo about COVID claims. Doon sa no payment. Yun yung tinatanong ko po sa inyo kanina pa kasi ito yung problem. Walang problema po doon sa ibinalik ninyo na based doon sa 2017 circular ninyo. Pero yung sa COVID-19 under circular 2020-009 in the general guidelines letter C. Dr. Glenn?
You're correct nga po, Madam Chair. In 009, there was a provision that states that there shall be no co-payment nga po. However,
currently, after
as a general po,
Dr. Glenn, from August 22, dito sa inyong circular, okay na, may co-payment
okay
na,
po.
allowed na.
Opo, allowed na po.
Dr. Almora?
Yun pong circular.
Yes. Madam Chair, the circular that was mentioned of the no co-payment policy, yes, I'm just wondering why they are still using the PhilHealth Circular 2017-007 when this is all the pre-UHC period, meaning the provisions of the Universal Healthcare Law should already be the one that should apply, and it should supersede already these matters pertaining to no co-payment. And so I wonder why they are still using this old. I don't know really what's the specific provisions of this circular 2017, but I believe whatever there is, the provisions of the Universal Healthcare Law should supersede, Madam Chair.
We'll check that, Dr. Almora. Review ko lang kasi hindi ko alam kung ano yung naka-state sa dash doon sa 2017. But under UHC law kasi, basic accommodation ay no co-payment, no? At ang basic accommodation is ward accommodation. So malinaw tayo doon. Please check at na lang President Attorney Geran, i-align po natin doon sa UHC law.
Madam Chair, if I may.
Yes po. State your name.
Dr. Clempo.
Dr. Glenn, okay.
I would just like to update po, give an update on the transitioning from the NBB to no co-payment policy. No, as mentioned by Dr. Almora, it is stated in RA 11223 na the coverage there's a coverage to include all Filipinos who are admitted to basic or ward accommodation na doon po mag-a-apply yung no co-payment policy. And last year po, we issued PhilHealth Circular 2020-0024 titled Governing Policies on No Co-Payment or No Balance Billing for PhilHealth Benefit Packages to provide general policies on how to provide general policies on the no balance billing or co-payment. The DOH, for its part, also published the DOH AO 2021-0015, establishing the standards on basic or ward accommodations in all hospitals. And that section 9.9 of RA 11223 provides that PhilHealth shall issue implementing guidelines to operationalize the no-fault payment. So, aligned with this, there's parallel effort from PhilHealth to craft the implementing guidelines to operationalize the no-fault payment as provided for in the UHC Act. And part of these steps are we have a draft policy for that, and there's an ongoing consultation. This time po, we are doing consultations. The first consultative meeting was held last September 29, which was attended by the representatives of the society groups as PHA was there po, the Philippine Alliance of Patient Organization, Philippine Medical Association, the Private Hospitals Association. And last October 7, the second consultative meeting was held and attended by the specialty hospitals, including Heart Center, Lung Center, the National NKTI, San Lazaro, PCMC, and the Philippine Orthopedic Center. The attendees of these two consultative meetings were requested to provide inputs and recommendations on the draft of the implementing guidelines. And we are currently in the process of consolidating all the issues and concerns identified regarding this policy, Madam Chair. And once we finalize this one, taking into consideration all inputs from the different stakeholders, we will issue the implementing guidelines of the no-fault payment policy, and this time it is aligned to the UHC law. Thank you, Madam Chair.
Thank you, Dr. Glenn. Bigyan lang ang committee namin ng update on the development once nakapaglabas kayo or draft at least on that as a result of that consultation.
Chair.
Okay, thank you so much. Do we still have members who wish to ask question? Okay, kung wala na po, again, ulitin ko, Mr. President, we'll call you again for another meeting based on what we discussed earlier on, again, confusions made by the recent circular that we published and for implementation, and other matters that we need to discuss regarding PhilHealth po. Ang last na lang, how's the payment of COVID claims? Anyone from PhilHealth? How's the development? Kasi meron po ako natanggap na data from General Santos City, wherein ito po, may nakuha po akong data from General Santos City, total unpaid claims 834,532,820 involving 8 hospitals. Nakalagay po dito yung mga details of each of the hospitals. Mr. President, kumusta po yung development noon pong fast-tracking the payments, especially yung COVID cases natin? Mr. President?
Please recognize Attorney Inay Santos, the CEO of PhilHealth.
Okay, Attorney Santos.
Good afternoon, Madam Chairperson, honorable members of this committee. Madam Chairperson, the PCO has given clear instructions to monitor what's happening in General Santos City under the PhilHealth Regional Office 12. So we have been monitoring the situation there, Madam Chairperson, and based on the report of the RVP, particularly Dr. Hector Malate, they were able to reconcile with the hospitals in General Santos City. And the amount you stated a while ago, Madam Chair, was also considered by the regional office in Pro-12, and they made a commitment to pay, Madam Chairperson, on the end, towards the end of October 2021. And according to the report of Dr. Hector Malate, they were able to comply with their commitment. Madam Chairperson, it's just that I do not have the complete data or the exact amount of how much we were able to pay, but rest assured, Madam Chairperson and members of this honorable members of this committee, that PhilHealth Regional Office 11 was able to comply with their commitment to pay the hospitals in General Santos City. Madam Chairperson, honorable members of this committee, thank you.
So attorney, you confirmed na meron talagang this amount unpaid claims for over the years, no? Accumulated unpaid claims.
Madam Chairperson, if I may, I confirm, Madam Chairperson, that this is based on the claim based on the report of the Regional Vice President of PhilHealth 12, that there is delay in payment, but they were able to reconcile this amount, Madam Chair. It's just that I cannot confirm the amount of 834 million, but whatever they agreed upon to be paid at the end of October 2021, they were able to comply with this, Madam Chair. My commitment, Madam Chairperson, is that we will submit a report to this committee regarding what happened in General Santos City, Madam Chairperson.
Thank you, Mr. President. Okay. Salamat po sa oras ng PhilHealth and all other guests, Department of Health and our professional associations. Dr. Almora, meron po kayong last comment regarding po doon sa na-mention on unpaid claims and the threat from some hospitals to disengage.
Yes, Madam Chair. There is also a threat from the hospitals here in Tuguegarao, Cagayan, Madam Chair. However, I advise them that they should look at their accounts to really make sure that they will be able to reconcile with PhilHealth, because the problem really is there is no unified way of reporting. The dates alone, sometimes they are not unified. So first is there has to be a unified form, so that when the hospitals and PhilHealth will reconcile, they will be speaking on the same level. They are basing their analysis from common data. So that is the first thing that they should do before doing anything, is to make sure that they have reconciled with PhilHealth. And there is a commendable action being done here in Area 1, or the Northern Luzon area, which is headed by Senior Vice President Mr. Walter Bacaresa, to try to solve the issue. And one of these things is the regular reconciliation of records. And they are going to activate all the PhilHealth offices so that they will be able to reconcile. And also for PhilHealth to help the hospital management to find out where the problem is, because there is a possibility.
Ayun, kita nyo mga kaibigan, napanood nyo yung ginawang deliberasyon ng mababang kapulungan ng Kongreso tungkol dyan sa mga benefits ng mga health workers, mga frontliners. No? Pero alam nyo, last year pa yung pandemic, no, 2020, bakit ngayon lang? Ba't ganyan? No? Kaya minsan, sa totoo lang, kaya maraming mga nurses, doktor na nagpupunta ng abroad. Dahil, bakit? Dahil maliit eh. Maliit ang pinasusweldo rito sa atin sa Pilipinas. Samantalang sa abroad, nurse pa lang, may napakalaki ho ng sahod. No? Kaya doon sila nahandong, katulad ng kaklase ko. Ha? Taga rito po sa atin, Pinoy. Graduate ng nurse. Pero, bakit siya nahandon? Bakit siya nasa US? No? At wala rito. Kasi nga, una, maliit ang sahod. Pangalawa, katulad niya, nagkaroon ng pandemic. Yung mga benefits, wala. Nga. Di ba? So, hanggang sa may namamatay, etc. Alam ko, sa Kainta, merong doktor noon, o nurses yata, kung di ako nagkakamali, o doktora, na namatay dahil sa COVID. Pero, yung benefits, parang kulang yata, or whatsoever, parang yung ang anak parang nagreklamo pa no? Pero ganun pa man, sinabi naman ng mayor ng Cainta na ibinigay niya yung dapat, etc. Pero yung sa gobyerno ang sinasabi natin. Hindi natin masisisi yung iba nating kababayan, maging nurse, doktor, teacher, engineers, o whatsoever, na mga ibang bansa. Kasi nga po, malaki po ang sahod nila ron. Yung sahod dito nila, na for example, sa isang taon, no? Doon sa abroad, sa ibang bansa, yung sahod nila dito sa isang taon doon, minsan isang buwan, 2 buwan lang nilang pinagtatrabaho, sahod na rito ng isang taon. So, ganun ang diferensya, no? Bakit ganun? Ba't ganun ang sistema? Bakit doon sa abroad, sa ibang bansa, malaki ang sahod? Bakit dito hindi kayang ibigay yung ganun kalaki sahod? Diba? So, yun ang mga tanong. Kaya, oo, dapat nga Pinoy, Pilipino, dapat dito talaga. Ang problema, hindi kayang ibigay, hindi kaya sustinihan ng gobyerno. Di ba? Katulad lang ng ating mga engineers. Di ba? Engineer yan. Pero ang laki ng hirap niya sa pag-aaral, pero pagdating dito sahod. Sa abroad, ang laki. Kaya, hindi natin masisisi. Ganun din ang mga teachers. Kapag doon nagturo, ang laki ng sahod. Pero dito, kita nyo, dahil nagbuwelga mga teacher. Di ba? Bakit? Yung kanilang allowances, sinasabi, yung mga clothing allowance, yung kanilang basic, hindi sapat na. No? Hindi na kaya ika. Paano gagawin natin? Kahit naman ako yon, kahit kayo, siyempre, ano gusto nyo? Natural, di ba, yung malaki sweldo. Siyempre, unang lalo na kung may pamilya, may mga anak na pinag-aaral, mahirap, no? Hindi kaya isusustinihan. So yun, dapat siguro ang mangyari, sana nga matuloy ang mangyayari na maupo si Bongbong Marcos para masolusyonan na lahat ng mga problema, suliranin ng bawat Pilipino. Na sana, bukas makalawa, darating ang time na yung mga Pilipinong nasa abroad babalik ng Pilipinas dahil okay na. Magiging maayos na at hindi na nila kinakailangan mag-abroad dahil dito pa lang ay kikitain na nila at kikita na sila ng maganda para sa kanilang pamilya. Hindi na magkakaproblema ang mga Pilipino, ang Pinoy, bawat isang Pilipino. Kung baga sa kahit na ang trabaho yun lang maayos ang magiging kita at hindi sila magkakaproblema, hindi kakapusin sa pagkain, sa kung umuupa man ng bahay, lahat masusustunihan ng bawat pamilya. Okay, so mga kaibigan, sa oras natin sa udyat na alas 7:41 po ng gabi, Philippine Standard Time, mabay pansamantala po magpapaalam muna tayo at muli tayo magbabalik bukas, araw ng Huwebes para sa ating Thursday edition at syempre, bukas din yung ating online haranista na si Randel Villados. No, bago tayo magpaalam, abay maraming salamat po kila Baki po Mag-Rappler, kay Bambo Garcia, no? At kay Barangay Kagawad Ruben Almoy Tilichauco ng Barangay Pulo dyan sa Valenzuela. Ha? At sino ba? Ayun, si Paring Bengbeng, no? At gayon din si meron tayong nakita rito. Yan, si Naidang Aisel Esteban na taga-barangay Bibiklat po dyan sa Nueva Ecija sa Kuya po. At hindi kay Bambo Garcia, kay Boss Demi, maraming salamat. Okay, so yan mga kaibigan, sana sa ating gobyerno, yung ating mga frontliners sana, talagang dapat bigyan ng pansin yan. Una-una, sundalo, tama yung ginawa ng Pangulong Duterte. Mga pulis, sundalo, siyempre dapat mga teachers, tsaka yung mga frontliners. No? Kasi teachers, frontliners din po yan eh. No? Media. Meron nga akong nakita mga media na dapat ang media ay binibigyan din ng karapat-dapat na ayuda buhat sa gobyerno tsaka mga allowances kasama rin dahil frontliners din. Ewan kung paano magiging kasi ang media alam ko nasa tayo third state no ng bansa, di ba? So yun sana ganun kasi kung magkakaganon po wala na magiging problema, hindi na kailangan mag-abroad, etc. O yung iba pa man hindi kinakailangan lumipat ng ganito, ng ganyan, di ba? Dahil ayos ang kanilang kinikita, wala sila magiging problema sa kanilang mga pamilya. Okay? So mga kaibigan, at pansamantala ko po yung magpapaalam, siyempre ako pa rin yung naging kasama, kachokaran, kajaming, kakosa, kabarangay, katropa, dito po sa programang Tropa, Rosel Lopez. At nakasama ko po sa technical side si Joshua Sumulat Baltao. Magandang gabi Pilipinas at mapayapang magdamag.
Ikaw ba stress? O may dinaramdam? O gulong-gulo na talaga isip mo? Tumutok lamang at panoorin dito sa Millennial Online TV. May tuturo po ko sa inyong isang paraan upang maibsan at mabawasan niyang problemado ninyong pag-iisip. Ito ay ang Tai Chi Learning Series. Sana po tumutok po kayo at abangan niyo po kung Sabado po ng umaga yan. Dito lamang po sa Millennial Online TV. Salamat po!
Hanap mo ba ay Unwind Ventures? Tara nang mamangha sa mga tanawin. Ano man ang iyong travel goals? Dadalhin namin kayo. Sa Unwind Ventures at saya. Dito lang sa Wow Biyahe. Kaya wow, di ba?
Abangan dito lang sa Millennial Online TV.
Barangay, pangunahing unit ng pamahalaan lokal kung saan dito pinag-uusapan ang bawat sigalot ng mga residente ng bawat barangay. Dito rin pinag-uusapan ng mga piling halal na opisyal na barangay ang mga proyekto para sa kanilang barangay. Kumustahin natin ang panunungkulan ni Kapitan dito sa Dama Barangay sa Millennial Online TV worldwide, ang katropa ng bawat barangay.
At tinatapos ang ating pagpupulong. Maraming salamat po sa inyong pagdalo at tapos na po ang ating session. Enjoy na po tayo.
Mga pangyayaring naganap sa ating kapaligiran, mga balita sa buong linggo, ihimayin, iisa-isahin, dito sa Balitaktakan, aarangkada, kasama si Brian Enyosa, dito lang sa Millennial Online TV. Pinaigting, pinalakas, ang bagong news online TV ng bagong milenyo. Millennial Online TV, ang katropa mo sa pagbabalita.
Mga katropa, ako ang inyong lingkod, Ryan Anyosa. Samahan po ninyo ako sa panibago nating programa dito sa Millennial Online TV, ang Balitaktakan, kung saan pag-uusapan natin ang lahat ng mga balitang bumabandera sa isang buong linggo at mga impormasyong dapat ninyong malaman. Paano kami mapanood? I-type lang sa inyong mga Facebook at YouTube account ang Millennial Online TV. Ano pang hinihintay mo, katropa? Like, subscribe, at share na!
Mga katropa, ako po si Randel Villados, ang online naranista ng bagong milenyo ng Millennial Online TV, na nag-aanyaya sa inyo na makikanta, makisaya, at tumutok sa lahat ng programa ng Millennial Online TV. I-type lamang sa inyong Facebook at YouTube ang Millennial Online TV. Nood na mga katropa!
Mga katropa, ako po si GHAZI Sarip, ang inyong tagapaghatid ng balita sa bagong milenyo, na nag-aanyaya sa inyo na tunghayan ang aking mga pag-uulat at tumutok sa lahat ng programa dito sa Millennial Online TV. I-type lamang sa inyong Facebook at YouTube ang Millennial Online TV. Nood na mga katropa!
Mga katropa, ako po inyong lingkod, si Rosel Lopez, ang inyong katropa, ang inyong kabarangay ng bagong milenyo. Abangan po ang aking mga tatalakayin na mga kaganapan dito sa ating bansa. At syempre, abangan nyo rin ang gagawin nating pangungumusta sa panunungkulan ni Kapitan sa ating dalaw barangay. At syempre, ay tunghayan nyo po ang lahat ng programa ng Millennial Online TV. I-type lamang po sa inyong mga cellphone sa Facebook at YouTube, Millennial Online TV. Okay mga katropa? Pinaigting, pinalakas ang bagong news online TV ng bagong milenyo. Millennial Online TV, ang katropa mo sa pagbabalita.
Nais mo bang guminhawa ang iyong pakiramdam? Kung ikaw ay may sipon, ubo, lagnat at iba pang nararamdaman, lalo na ang sakit ng katawan, narito na ang Yasmag Magnesium Therapy Oil. Ang Yasmag Magnesium Therapy Oil ay nakatutulong na ibsan ang iyong nararamdaman sa pamamagitan ng pagpahid sa apektadong parte ng katawan, gaya ng noo, balikat, tuhod at kung anuman ang masakit na parte ng iyong katawan. Panoorin ang mga testimonials ng gumamit ng Yasmag.
Yan po, ginagamit niya. Siya po ay isa sa aking mga testimony.
Ako, si Destino Francisco, ay gumagamit ng Yasmag na siyang nakapagpalakad sa akin. Kaya kayo, mga kaibigan ko at kakilala, ay pinapayuhan kong gumamit ng product na ito.
Isa sa ating testimony, ikukwento po niya sa inyo yung kanyang result nung siya ay 1 linggo nang nilalagnat at giniginaw ng hihina.
Hi, ako po si Rina Liliantos, 29 years old, taga Sariaya, Quezon po. Nangyari po sa akin, itong mga nakaraang araw po ay hindi ko po maintindihan yung pakiramdam ko, gawa pong ang sakit po sobra ng likod ko, nilalagnat ako, tapos po ay hindi lang po 1 linggo ang nararamdaman ko. Simula po nung July 30 hanggang itong araw, hanggang nung mga nakaraang araw. Yun lang po, nawala lang po ng dahil sa magnesium.
Paano ginawa mo?
Ang ginawa lang po sa akin ay pinahinaplas po sa akin likod kung saang parte ng katawan ang masakit. Tapos po ay hinilot lang po ako. At hanggang po pagpawisan ako sa pagkahilot na may magnesium. Ayun lang po, sunod-sunod po ang paglagay kung saan banda ang may masakit. At yun nga po, ilang araw lang sa paggamit yun ng magnesium, ako mismo, sarili ko, ramdam ko ang pagbabago sa aking katawan. Dahil po simula nga po nung July 30 hanggang itong itong mga nakaraang araw lang, hindi ako halos makatayo dahil sa sobrang sakit ng aking likod.
Ako po si Leslie. First time ko po mag-try nitong Yasmag Magnesium Therapy. Ang una ko pong naramdaman ay ang bango niya sa ang bango niya lang hapin, nakaka-relax ng katawan. And then yung sakit na iniinda ko sa puso, yung sakit-sakit, wala naman ako sakit sa puso, pero yung mga kirot-kirot nawala niya, instant nawala, na tagal ko nang iniinda. And then hindi siya malagkit ipahid.
Binaigting, binalakas ang bagong news online TV ng bagong milenyo. Millennial Online TV, ang katropa mo sa pagbabalita.
Now,
Talakayin, rebisahin, opinyon, palawakin, aksyonan. Kasama si Rosel Lopez, ang inyong katropa, dito lang sa Millennial Online TV, ang katropa mo sa pagbabalita.
Mga kababayan, ang pambansang awit ng Pilipinas.
Kayang magiliw, ewas ang sinakalan, alam ng puso, sa titik mo'y buhay. Lupang hinirang, kuya ka ng magiting, sa mandulupin, di ka pasisigil, sa nagatak tutok sa simoy at sa langit ng bagaw, ay hinatang tula, kawin sa pagkayang minamahal, ang isang ng matawad mo'y tagumpay na naghihinig, ang bituin at karoon niya kailan pamay di maghihinig, luha ng araw ng waragin pagsinta, buhay langit sa piling ko. Ang inigaya na pagkay mga amin, ang mamatay ng dahil sa'yo.
Sa lahat ng bumubuo ng Millennial Online TV at sa lahat po ng sumusuporta, maraming salamat po. Millennial Online TV is now signing off.